second half of the Dominic Cummings.
Order. We're going to resume
Health
the
and
session
Social
now,
Care Committee
and we're going to take two sessions together of our
are
4 sessions.
Cummings about the
The
lessons
session
learned
where we look at
from the
the
COVID-19
lockdown
pandemic.
measures
So, without
that
further
we
ado, let's go
adopted
live to the
and
stream.
how we tried to contain the pandemic after
And remember,
March
if you want
the
to watch
16th.
today's Prime Minister's questions at the
and then we're
first
going to look
half
at the
of the
vaccine
session,
programme.
you can find that all down there
And
below
I
in the
want
videos
to
and live stream
start, if
section
I
of this
may,
channel.
Mr. Cummings,
Just subscribe
by
for more. We're just going to be streaming this
looking
as
at the
long
test
as
and
it
trace
goes on.
programme.
So stick
Now,
with
the
it
WHO, as we all know,
Say
is
hello in
talking
the
about
chat.
test.
and enjoy what you're
South Korea,
enjoy
Taiwan,
it if
as
you
you
can, I
talked
guess.
about
So here we
earlier,
go.
were using
Jeremy
test and
Hunt, take it
trace
away.
to avoid national lockdowns. But on the 12th of March, we stopped community testing in this country. That was following very clear sage advice that when there was sustained community transmission, contact tracing will no longer be useful. Now, you talked before at length about how there were problems in mistakes in the scientific consensus up until the weekend of the 14th, 15th of March.
Yeah.
But SAGE didn't even model Korean-style test and tracing until May. So
Yes.
why was there such a long delay, even after that March inflection point?
Well, fundamentally, it goes back to what we talked about at length in the previous session. That the logic was, if you're going for the optimal single peak strategy, herd immunity by September, then in the same way that you don't take vaccines as a kind of urgent priority, you don't take testing as an urgent priority, and that's why the Department for Health said in that week we don't need to test everyone anymore, because the view was simply, well, 60% or 70% of the country or something are going to get it. That's going to happen for sure. Why would you even bother testing all of those different people? Because we're not going to have a test, track, isolate, quarantine system, because we're going for herd immunity by September. So no one challenged really that idea strongly until we challenged it as part of the whole kind of shift to Plan B. There were conversations about it. I asked Patrick and Chris about it. But I mean, even in late March, PHE said officially on the record, possibly even to this committee, I can't remember now, well, obviously there's just no way that this country is going to do test, track and trace like they're doing it in East Asia. That was that was just completely common assumption. Now, I and others, including Patrick Vallance, started to push back against that and say, hang on a second, if we're going to go for accelerate it, if we're going to ditch Plan A and then try and accelerate as fast as possible towards lockdown in the coming days, the whole point of that is you're then buying time, and then of course you've got to deal with the fundamental argument that you've got a second wave coming in the autumn. So of course we're then going to have to build a test, track and trace system from essentially ground zero pretty much. But those conversations didn't really properly happen until after that weekend and after I started talking to people about Plan B.
So I'm just curious about why it took so long, because SAGE, as far as I can tell, didn't actually model test and trace as a containment strategy for 2 months after that. And we didn't actually set up test and trace until the end of May.
Yes.
That's a very long time. So you realise that Plan A is wrong.
Yes.
You change direction. Why did it take another 2 months before we got into gear with South Korean style test and trace?
Essentially because, I mean, but remember that, in lots of ways, the whole core of government fundamentally fell apart on the Friday, the 20... what is it? Friday, the 20... the day that the Prime Minister... So, we had the lockdown on the 23rd. On the So on the over the weekend, so slightly backtracking, over the weekend of the Saturday 14th, Sunday 15th, one of the things that I did was I called a brilliant official who had been working on the Brexit no deal preparations, a guy called Tom Shinner, and I said to him, total meltdown. We need all great people. Will you quit your job on Monday and come in? He did. He then went to a whole bunch of people who he'd worked with on the Brexit preparations, including the former commanding officer of the SAS, a guy called Alex Cooper, who was a brilliant guy. Alex Cooper was then essentially drafted in to build a team to start building factories on the ground, to start trying to take this. You had PHE, this entity that was doing very few tests and had no plan for how to expand it and didn't think it was possible for all the reasons we've discussed. Alex Cooper was then basically given the job, build a team and start going around and building factories so that we can scale this whole thing up. However, the government then basically, the core of the government kind of collapsed when the Prime Minister got ill himself, because he's suddenly gone and then people are literally thinking that he might die. By the time I came back on the 13th, I think it was, of April, we had this terrible situation where Alex Cooper and his team were trying to build the foundations for a whole new test and trace system, for mass testing, to PCR, the whole thing. And of course, bear in mind at the time, we also had the classic problem that all the supply chains were collapsing because we couldn't buy all the stuff that we needed abroad because everybody was kind of impounding things on the airfields and whatnot. So we had to do all of this domestically and build a domestic manufacturing up. In my opinion, disastrously, the Secretary of State had made, while the Prime Minister was on his near deathbed, had made this pledge to do 100,000 by the end of April. Now, this was an incredibly stupid thing to do because we'd already had that goal internally. We'd already had conversations 10 days earlier to say, instead of cancelling testing, we should be ramping up testing. And it shouldn't just be 100,000, we should be heading for 1 million tests a day and more. But that means building the kind of architecture and the foundations to do all this properly. What then happened when I came back around the 13th was I started getting calls, and Number 10 were getting calls saying, Hancock is interfering with the building of the test and trace system because he's telling everybody what to do to maximise his chances of hitting his stupid target by the end of the month. So we had half the government, with me and Number 10, calling around frantically saying, do not do what Hancock says. Build the thing properly for the medium term. And we had Hancock calling them all saying, down tools on this, do this, hold tests back so that I can hit my target. Now, in my opinion, he should have been fired for that thing alone. And that itself meant that the whole of April was hugely disrupted by different parts of Whitehall fundamentally trying to operate in different ways, completely because Hancock wanted to be able to go on TV and say, look at me, my 100k target. It was criminal, disgraceful behaviour that caused serious harm. Now, one of the consequences of it was, we'll get onto that with the vaccine programme. That was one of the reasons why the Cabinet Secretary and I agreed that we had to essentially take testing away from Hancock and put it in a separate agency. So we could say, here's a separate person responsible directly to the Prime Minister and the Cabinet Secretary that Hancock couldn't interfere with theoretically. So there was all this bureaucratic infighting in April. Remember, the Prime Minister wasn't back then either. Dominic Cummings was doing a brilliant job chairing the meetings, but this was a huge call and very difficult for him to, basically start carving up the Department of Health in April. So essentially, we never really got to grips with it until the Prime Minister was back in the office and the Cabinet Secretary and I could say to him, we've got to do the track and trace thing in a completely different way.
But would it be right to say that you had the kind of what you describe as the meltdown weekend when we went into the first lockdown, we moved to Plan B, but that actually wasn't the point when, as a country and as a government, we said we're going to go South Korean.
Correct.
We were basically saying it's time to save the NHS and take these emergency measures. What was the point at which we said we're going to do it the South Korean way?
Well, I mean, it was an emerging thing. So over the week after the meltdown weekend, the week of the 16th, you had kind of part of the system still operating, and all the graphs of at the time, which I can share with you, show the system, the kind of official Cabinet Office DH system is still showing all the graphs as if we're going along towards herd immunity in September still. The same week you have me and others trying to bounce the system into locking down, to racing through everything as soon as possible, and hacking together what Plan B would look like. But it was extremely disjointed and confused. You know, there's texts from me to people saying, we've got to have a plan for 100,000, we've got to have a plan for 1 million tests. Instead of closing it down, should be wrapping it up. But it was, we didn't even have a plan for lockdown. So we were trying to get to lockdown and also get other people working on what would this South Korean thing look like. Then the Prime Minister goes down and nearly dies. So it was really only when I come back in the second half of April, I talked to Tom Shinner, I talked to the Cabinet Secretary. Both of them are tearing their hair out about the situation, about the 100k target, quite completely correctly, saying to me, we've got to do something about this and we've got to get a grip of Hancock. But it was really only when the PM came back and then we sat down and said, look, we've got to set up a separate agency. We've got to rejig the whole Whitehall paraphernalia around this, and we've got to build the testing system, but also the whole data system, and potentially another whole set of tools as well. So what I wanted to do was essentially the same as had happened in South Korea and Taiwan and places, where you start using bank data, you start using mobile phone data to triangulate where people are, use the data coming off cell phone towers and things like that. So it wasn't just the testing system that we had to get built up, it was also the whole data architecture as well. And of course we had huge legal problems, because you had a whole bunch of people coming back in the legal system saying, first of all, EU data law on GDPR basically means all of this stuff is illegal, medium term, and secondly a whole bunch of things around European Convention of Human Rights, right to privacy, etc, etc, etc. So we've got to build this testing, we've got to build this data, we've then got to think about all these complexities about the legal side. Now, back at the end of February, I got the Cabinet Office to call the ICO and basically put out a notice that just said, if you're working on COVID, assume that what you're doing is legal in terms of GDPR. I mean, completely extraordinary thing. No one even knew if that itself was legal, but almost definitely wasn't. But we were otherwise faced with the fact that if someone somewhere in the system didn't say ignore GDPR, thousands of people were going to die because no one could even connect up all these databases anywhere. So we had all of these problems happening in parallel. It only really got properly discussed, I would say, in detail in May, about what are the technical, operational, legal, everything else things that you need.
At the end of May, NHS Test and Trace was finally set up, Baroness Harding was appointed. Can I put it to you that by that stage our daily infections had got up to 2,000 a day?
What, sorry?
By that stage, at the end of May, when NHS Test and Trace was finally set up, our daily infections had got to 2,000 a day.
Yeah.
And actually, that was just too high to have an effective test and trace system. No one in the world has got test and trace going South Korean style at that level of daily infection. And so that a lot of the problems that we had, and a lot of the reason why test and trace didn't succeed in preventing later lockdowns, was because we left it too late, the daily infections were too high, and that was just literally too many people to track down and ask to isolate.
I mean, I think you're kind of 98% correct. I mean, how effective we could have made it, and whether you're exactly right in terms of the 2,000 threshold and whether or not we could have coped with that, I think is a complicated question. But I think the kind of conceptually what you're saying is fundamentally correct. That we left, it took too long to get set up. The system was hugely distracted in April by the Hancock Pledge, but also fundamentally, this should have been happening from January. That's the central thing. The problem is that between January and roughly mid-March, everyone was thinking, well, given we're doing one single peak herd immunity by September, there's no point building up this whole thing, apart from the second bit of the groupthink, which was the country won't stand for it. Now, my argument, other arguments, Patrick Vallance and other people said, actually, in the same way that everyone was wrong about the country accepting lockdown, we think that everyone is wrong in Whitehall who is arguing against the track and trace thing, that people will accept this kind of infringement on civil liberties, because what's the alternative? Fundamentally, the only alternatives are you do herd immunity strategy at some point in 2020 with hundreds of thousands of people dead, or you lock everybody down and bankrupt the country until you manage to get vaccines going, or you try and get some kind of test and trace system going and enforce it, and then potentially with local lockdowns as well. So for all those people saying, oh, well, we can't do it and it's left too late and everything else, my argument was, well, what the hell else are we going to do? We're going to go back to plan A.
But you did have one of the most powerful positions in the government. You were the Prime Minister's principal advisor, and understandably you were ill for a part of that period. But do you blame yourself for the fact that it took another 2 months after that incredibly challenging March weekend to actually get SAGE to model, test and trace and to get the thing set up?
I blame myself for many, 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 many things in this whole crisis, but one thing I can say completely honestly is, I said repeatedly from February, March, if we don't fire the Secretary of State and if we don't get the testing into someone else's hands, we are going to kill people and it's going to be a catastrophe. So, I wasn't the only one telling the Prime Minister that. I made lots and lots of mistakes, but I honestly don't think I could have been any more explicit with anybody at this time about this. And I actually went with the Cabinet Secretary to the Prime Minister directly and said, the Cabinet Secretary said to the Prime Minister, because remember, in April, we had this terrible pledge which was hugely distorting the whole system. We also had constant repeated lying about PPE. The Cabinet Secretary said to the Prime Minister in almost the first meeting when he came back, Prime Minister, the British system is not set up to deal with the Secretary of State who repeatedly lies in meetings. Okay. We can't operate like that.
You have made that point, Mr. Cummings, and we've got Secretary of State.
We couldn't. But my point is, we couldn't get to grips with the test and trace until we got it out of DH's hands into a separate agency.
Okay. Now, those are very serious allegations, said under parliamentary privilege, and we've got Mr. Hancock coming here in 2 weeks' time to respond to those. But as Greg Clark said, we'd be very grateful for any evidence that you have to back up those assertions before Mr. Hancock comes to this committee. I've just got one last question on test and trace, and then I'm going to go to my colleague Dawn Butler. One of the issues with test and trace, just with a longer term horizon, is the fact that such a low proportion of people who are asked to isolate by the system, by NHS test and trace, actually isolated.
Yeah.
What's your analysis of the main reason why it is that, according to Dido Hardy when she was in front of the Health and Social Care Select Committee, it was between 20 and 40% of people at one point weren't actually isolating, despite the fact that they'd been near someone with COVID.
Yeah.
What do you think the flaw is in the system that meant that happened?
I think a huge problem was that it's a sort of slightly complicated thing to explain. I think that one of the problems that we had from the beginning that was critical at this time, and actually still is critical, is senior people did not understand well enough the problem of asymptomatic transmission and it being airborne, this combination. That's why the masks was all wrong as well. And one of the fundamental reasons why people, I think, were not isolating is that we, the government, failed terribly to explain to people that a lot of people are being infected asymptomatically, point one. Point two, it's airborne. And even now, even today, the government communications is still overstressing wash your hands and understressing airborne. And I think that was a big problem. So lots of people were not isolated because they didn't understand this basic point. It wasn't their fault. It was our failure to explain to people.
I think just much more practical, which is we never made a straightforward promise that any salary you lose from not being able to go to work because you've been asked to isolate, we will make up.
That was going to be my second point. Correct. So I think it was, we didn't explain both sides, right? We didn't explain the danger properly, and we didn't provide the incentive properly. And this was discussed at the time. I think there is no. I mean, I had meetings where I got people to literally print out the documents from South Korea and places that said, "Here's the South Korean system." That it's a combination of stick and carrot. That it's much stricter in terms of legal things, like you'll be put in jail if you break the quarantine. But we also will provide food to your door. We will pay you so that you're not financially disadvantaged, etc., etc. Like lots of things, essentially, if we just cut and pasted what they were doing in Singapore or Taiwan or whatever, and just said that's our policy, everything would have been better. I think there's just no doubt about that at all.
Thank you. Dawn Butler.
Thank you very much, Chair. Thank you, Mr. Cummings, for coming in to the committee today. A lot of things what you're saying, actually, from the evidence we've taken in the Science and Technology Committee, is now sort of making sense why it wasn't done. After the election, it seems like your job and went through the roof. The amount of work that you had to do went through the roof. Did you have time to prepare for that, or did you just jump straight in?
In terms of, you mean sort of January? No,
yeah,
I mean
after the election, because
I basically didn't have a day off between. I had sort of Christmas Day 2019 was a partial day off. I basically didn't have a day off between 24th of July 2019 and the day that I left Downing Street in November 2020.
Okay, and you were talking about data and GDPR and track and trace. Faculty AI is like you know Faculty AI very well, and Palantir, is the data harvesting company. Was that your brainchild to get them working in the NHS?
No, so the NHS had hired, as I referred to earlier on, the NHS hired faculty, I'm not sure when, sometime in 2019. I'm 95% sure that it was in 2019, before the election, that Simon Stevens hired faculty to do, but that wasn't really to do with core NHS data stuff. That was to do with very specifically building an AI lab for the future. It was kind of how can we use data science and AI techniques over the next 10 years on things like genomic data or on all kinds of NHS data. What then happened was, it was complete fluke, just good luck. They were already working in the NHS with NHSX, the particular division of NHS. So then when we started to really hit the crisis on COVID, Simon Stevens spoke to Mark Warner and said, look, ditch the kind of long-term AI stuff. Can you help us with the immediate data problems? So Mark then brought his team in, and that's partly what the kind of very, very fortuitous chain of circumstances is why he then started telling me on the 5th of March, I'm in these meetings about the plan. This plan seems insane. Like, is this really right? So we kind of got lucky. Palantir were brought in after that, essentially because Mark Warner and faculty talked to, as I said, referred to earlier, this outstanding official, Nin, who was working in the NHS. They essentially were kind of looking through all the things they needed to do, and they agreed, right, I can't remember now, but it was basically Microsoft will do this part of it, Palantir will do this part of it, some cloud service will do this part of it, faculty will do the kind of very sophisticated AI stuff. So Mark and Nin basically work with a team of people to kind of combine the best of the official system with getting help from companies, because some of these companies essentially had stuff that you could just use off the shelf. That was the thing, because by the 5th of March, we didn't have time to go around and start building a whole bunch of things from scratch. So what Mark and Nin did was they basically went around different tech companies and said, right, can we pinch that from you, that from you, that from you, that from you, and then kind of hack it together in the NHS.
And do you have any concerns around Faculty AI and Palantir at all? And
so I don't really know very much about Palantir. I know that Mark Warner is one of the smartest and most ethical people that I've ever met in my life. I think without him, thousands of people would be dead. And I know that his involvement in it has come at a lot of personal costs for himself and for his company. You know, him and his company have actually suffered in various ways from having got involved with the government and having helped. So
in what way have they suffered?
Well, just sort of huge conspiracy theories everywhere, all kinds of claims about, he was getting blamed for the app. Faculty were getting blamed, which they had absolutely nothing to do with whatsoever. And it was all, it all became part of this conspiracy of Cummings, Facebook, the referendum, data. Cummings is building the app.
Were they involved with that? You mean they were getting blamed for the app that got scrapped?
Exactly.
Yeah.
All sorts of things like that, which were reputationally damaging, which they had literally zero to do with.
Yeah. Was that because of the within the data protection within the app that got scrapped? There was something in there that said that people's data would be kept for 20 years. Was it because of that why they were being blamed? Because obviously their job is genome sequencing, so that would really help having data for 20 years.
No, so first of all, faculty doesn't do genome sequencing. Secondly, they had literally zero involvement, as far as I'm aware, in anything to do with the app. Why exactly the first app failed, I understand. I mean, I was not greatly involved with this. My understanding is that it failed because fundamentally Apple and Google insisted on certain kinds of certain kinds of controls about how the data
at the
would be
beginning
used.
Before it even started, right? That the Bluetooth wasn't going to work. But
with respect, I think it was actually really complicated. I mean, there were all kinds of complicated discussions about technically what was possible, and I think
there was only one other country that was trying to use the same sort of technology using Bluetooth, and they had to scrap it. But I don't want to get into that.
Sure.
Can I read you what Amnesty has said? Amnesty has said that Palantir is a data mining company, and over the course of the coronavirus pandemic, the UK government has quietly granted access to millions of UK health data records to Amazon, Microsoft, Google and Palantir to build a COVID-19 database. So Amnesty has expressed some concerns around who has the data and what they're going to do with it.
Yeah.
And they stress that the public needs transparency.
Yes.
Do you agree with Amnesty?
I completely agree that the public needs transparency, but I think, from what you've read out, I think that there's a fundamental misunderstanding in what Amnesty is saying. I'd be gobsmacked if non-anonymised data, patient data, is being shared with companies like that. I would bet a lot of money that's not the case.
Well,
I think that data is anonymised.
Well, online, when you sign up, so I went to order lateral flow tests to my home, and it actually says that your information may be used for different purposes and may not directly relate to your healthcare and may not be anonymised. And so it actually says that when you sign up. In the end, I didn't sign up, and I just went and picked it up from the local.
So you're talking about the NHS test and trace system.
So this is the NHS when you're ordering. So you say it's very unlikely that any of these companies would be given data that's not anonymised. And I'm saying to you that actually it's not that unlikely because it actually says it in black and white. But your data may be given to companies and it may not be anonymised.
Well, I mean, I'm not an expert on all of this and exactly which companies. I know that it's incredibly complicated. What I am sure of is that faculty does not have personalised data at all. They don't operate like that. Any data which they use is all anonymised. Personal data is no use to faculty.
Yeah, Palantir is more interested in personal data, right?
So
Faculty is more artificial intelligence.
it all depends which part. So I don't know to what extent Palantir. So as far as my only real engagement on the Palantir question was on the NHS kind of bed, ICU capacity, ventilator, etc. data. All of which obviously is not patient data at all. So there's no questions about personal records. That was my only engagement with the stuff, because I was building a dashboard. My engagement with the whole project was the data dashboard that Palantir was working with the NHS on for decision making. All of that was nothing to do with personal medical records of any description. Whether or not Palantir is also working on a separate thing involving personal records, I've no idea, I'm afraid. Don't know.
Move on from this, but did you have any more questions?
Yes, just can I ask just a quick couple of questions? Just Joint Biosecurity Centre.
Yes.
Can you just tell us a little bit about that? Because we don't know much about it, like who attends. Have you ever attended a meeting? Who's on it?
Yes. It was essentially it was created partly as an attempt to, as Jeremy said, to kind of like, how do we make this transition from plan A to plan B? A big part of it is test and trace and the whole data side. And obviously PHE had the senior management PHE had been, the whole thing had just not worked, just putting it politely. Everybody in April came to me, including the CSA and the CMO, and said, you cannot trust PHE with what needs to be built. So the new JBC was essentially part of the kind of Whitehall rejigging of the machinery. Right, we've got to strip test and trace out of DH. We've got to create a new surveillance function that can integrate all of this different data. Because we also had, at this point, I was getting the analytical private office number 10 built up, and they were looking at all these different things across the world. So there were things like sewage data. Right. You could start having all this different kinds of stuff coming in.
Who else was on it?
You needed to have an entity that could look at all of this different stuff and then...
Understand. Can I quickly just ask who else was on it?
On it in what sense?
Who else attended the meetings?
With me and the JBC,
Yeah.
I mean, it was just senior officials and... I never had any. If you mean with their private companies involved, no.
I don't.
Any
Right,
final?
yes. And the final question. I was just confused about Amazon. What role has Amazon played in all of this?
As far as I mean, all I can remember about Amazon is that Amazon came to us in March and offered help in various ways and said, look, we've obviously got a huge distribution network in various ways. If there are ways in which we can use that to help you, then we will. I've got a vague idea that we did ask them for some help on something, but I'm afraid I can't remember any details.
Thank you so much. Thank you, Chair.
Thank you. Graham Stringer.
Thanks very much for coming this afternoon, Dominic. It's been a fascinating, if incendiary, session. I think you've described the Secretary of State as a serial liar, stupid, criminal, disgraceful. Can you give us any insight into why he's still the Secretary of State? Why the Prime Minister didn't take your advice?
He came close to removing him in April, but just fundamentally wouldn't do it. I mean, it wasn't just me saying this, lots of people said it to him, the Cabinet Secretary said it to him. I mean, pretty much every senior person around number 10 said to him that we can't go into the autumn with the same system in place, otherwise we're going to have another catastrophe on our hands.
But can you give us any reasons that the Prime Minister gave for keeping him in position?
That would be speculation on my part. There's certainly no good reason for keeping him.
I mean, this joint inquiry about the two committees and the eventual major inquiry into it next year are looking at history. You were living this on a day-by-day basis. You were with a Secretary of State with an enormous amount of influence who told us is messing things up, having made mistakes, which you've been very open about in the first part. When it came to the second lockdown, and the Chair will come to that later, but similar mistakes seem to have been made. I know from working with you in a different context that you're a man of principle. Could you not have changed things by either threatening or actually resigning in order to stop some of this bad practice?
Yes, I could have done. And I thought about it. I thought about it in March. If the Prime Minister had basically not, if we hadn't successfully bounced things in the week of the 16th of March, I talked to various people during that week about saying to him that I will resign, hold a press conference and say that the government's going to kill hundreds of thousands of people. But we managed to bounce things through, and therefore I didn't do it. I had similar conversations with people in September, which I think we're going to come on to later on. And I did say I had a conversation with the Prime Minister. So, as has been reported, I was supposed to, the day that the Prime Minister became the Prime Minister, I was supposed to have an operation. I delayed it in order to go into term 10, then got delayed because of Brexit, it got delayed because of COVID. At the end of July, I went to see him the night before my operation, and I said, I'm going for this operation tomorrow. And you know, I'm reflecting on things. You need to know that I'm not going to be. I'm going to leave at the latest by Friday, the 18th of December. And I think it's best if you and I part ways. And he said, why? And I said, because this whole system is chaos. This building is chaos. You know perfectly well that, from having worked with me, that I can get great teams together and manage them. But you are more frightened of me having the power to stop the chaos than you are of the chaos. And this is a completely unsustainable position for us both to be in. And I'm not prepared to work with people like Hancock anymore. I've told you umpteen times you've got to remove him. You won't. It's going to be a disaster in the autumn, and therefore it's time that I should go. And the Prime Minister said, which I think says a lot, he laughed and he said, you're right, I am more frightened of you having the power to stop the chaos than I am of the chaos. Chaos isn't that bad. Chaos means that everyone has to look to me to see who's in charge. And I think that was just a fundamental problem. It was a fundamental problem in our relationship, and it was a fundamental problem in how Number 10 was governed, and it was one of the reasons why I said in July that I was going to leave. In all sorts of ways, I probably should have left then in the summer. The only reason why I didn't was because people said to me, we're going to have another disaster in the autumn, and you should stay because maybe you can persuade the Prime Minister of what to do, and maybe he'll listen to you. But from a personal point of view, it would have been far better for me to go in, but arguably it would have been better for the country as well.
That's very good. Claire, can I just move on to test and trace? You've explained that Alex Cooper was brought in to set up the test and trace system, and you had to get it out of the clutches of the Department of Health to set up a South Korean system. The South Korean system, I can't remember the figure off the top of my head, but it was pretty decentralised. I think there are probably about 155 laboratories set up, a lot more than were set up in this country. Were you involved with Alex Cooper in deciding it would be much more centralised than the South Korean system, or was that his decision? Why was the decision taken to centralise it?
So I think there's two separate things in there. There's centralisation in the sense of labs, but then there's centralisation in the sense of the actual contact tracing. I don't know what the logic is about I don't know how the trade-offs operate in terms of centralising a lot of the lab capability. It could well be that actually was the sensible thing to do in various ways, at least in the short term. Because if you've got to ramp up this huge capability, arguably what you do is you build a few really big labs that can kind of take the bulk of stuff, while simultaneously. So what also should have happened, and one huge problem that we had all the way through, was that we couldn't open up Whitehall to say, here are contracts for all kinds of relatively smaller companies that can contribute. So back in the days of February, March, when PHE was massively short of tests, we had companies banging on the door saying, we can help, we can help, we can help. And because of the whole procurement fiasco, we couldn't quickly integrate them and bring them in. So I think, when you've got a kind of national crisis like that, what should have happened is the government says, right, we're going to build a bunch of things, but we're also going to open up the system so that whoever can contribute and build, smaller companies can. Secondly, though, your point about the decentralisation on the tracing, I think my understanding is that you're correct, that in places like South Korea and Taiwan, one of the things they do is they have very strong local forces that are actually on the ground. And one of the problems with how things worked here in the summer was a system that was built that that in terms of the contract tracing was too centralised, and too much of it was trying to be done from kind of very big hubs. I stress I'm not an expert on this, and I didn't go into the kind of a lot of the details, but I did hear that criticism from a lot of people at the time. I stress that Alex Cooper himself and the people who got involved did an outstanding job within the remit that they had, but remember that they were not senior officials in charge of this. They were people taking orders.
When the National Audit Office did a report on tests and trace, how many billion had been spent on it, they said it was of only marginal benefit. One of the reasons was that the communication between the central laboratories and the local public health teams was either too slow or non-existent. People in the the second level of testing weren't being given they weren't passing the information on to local people. And I understand what you're saying about smaller laboratories and the contracts, but there were people like Paul Nurse, a man of huge distinction, university laboratories, public health laboratories, all offering to do it within their remit. Do you understand, can you tell us why those were turned down, and why the system between the central laboratories and the local public health teams didn't work, so that there's only a marginal benefit from all that expenditure?
Well, as I said, I think it was part of the general procurement horror in DH that people like Paul Nurse, we had companies beating our doors down in number 10 saying, we can't get people on the phone, we've got these tests, we can have them verified at Porton Down, etc., etc. That was certainly a huge problem. But also bear in mind, another whole part of this, which I think hasn't really been appreciated so far, is that it turned out that actually there was a brilliant young woman whose name now escapes me, who basically proved in March that this technology called LAMP could work for fast tests. And there was also other work done in March showing that lateral flow tests would work. And various people put together a plan for how to scale up all of this stuff in March. Now, in retrospect, the whole of autumn could have been completely different if this had been absorbed properly by the system on testing. We could definitely, without any shadow of a doubt, we should have been able to have tests on the order of 1 million or 2 million or 5 million a day available by the first week of September. Absolutely zero doubt about it. The problem on that was, for reasons which I never really quite understood, the first I was made aware of this was just a couple of days before my operation, so it must be roughly speaking, I think July the 20th, where a special advisor inside number 10 who I brought in, who was a scientist himself called James Phillips, he came to me and said, I've been talking to a whole bunch of scientists who have been working on this testing stuff. They're basically being blocked by every part of the system on doing mass testing. They haven't been able to get the money, they haven't been able to get the manufacturing and distribution, everything set up, but this could be a huge game changer while we wait for the vaccines. Now, we in Number 10 then got to grips with it. I organised a meeting with Patrick Vallance, people like John Bell at Oxford, and they both said straight away, yes, we should be doing this. Yes, it could be a game changer. Yes, we have dropped another massive ball by not working on this for the last 3 months. So essentially, I mean, in one sense, all of this should have happened from January. But then once we made the decision in kind of late March to go with Plan B and say Plan B involves testing, Plan B involves all of these different things, Plan B involves vaccine task force, Plan B involves blah. At that point, we should have been putting money into this whole lateral flow and lab stuff in March, April. And if we'd done that, then September would have been completely different. Because we'd have been able to have literally millions of tests and fast results, immediately, like 10 minutes, 20-minute results. Because we only realised that DH and other parts of the system had completely dropped the ball again in July, late July, essentially, and I only had the first meeting on it, roughly speaking, 20th, 25th of July, all of that time again was wasted. So then we were massively playing catch-up, August, September, October, to try and build all these things that should have already been in place before September.
Thank you. If I may, one last question.
Go please, last one.
One of the reasons the English death figures were very high at the start of this epidemic was the fact that untested people were sent back into care homes and they themselves got poorly and infected other people in those care homes.
Yeah.
Very large numbers of people died. Do you have any insight into how that decision was taken? And was Number 10 involved in that decision, or was it entirely a health department decision?
So that was one of the other things that that we found shocking. That when we realised in April that this had happened, the Prime Minister said, a less polite version of, what on earth are you telling me? But when he came back after being ill, what on earth has happened with all of these people in care homes? Hancock told us in the cabinet room that people were going to be tested before they went back to care homes. What the hell happened?
So he actually said in cabinet that
Not in cabinet, in the cabinet room.
Oh, sorry, not in cabinet. So, but directly to the Prime Minister.
Yes. We were told categorically in March that people will be tested before they went back to care homes. We only subsequently found out that that hadn't happened. Now, all the government rhetoric was, we put a shield around care homes and blah, blah, blah. It's complete nonsense. Quite the opposite of putting a shield around them. We sent people with COVID back to the care homes.
Thank you. That's extraordinary. Thank you.
Thank you. So we now have Anam Kaiser-Javid. She did her maiden speech last week, and it's her very first select committee. So welcome to you and your questions.
Thank you, Chair. I hope you're all as exciting and as engaging as this one. Thank you, Mr. Cummings, for joining us today. So you've referred to failures and you've made apologies. Is it fair and a fair assessment, however, to say that there's been a wealth of expert knowledge, whether that's from SAGE, from the CMO, even from university papers who have researched COVID. So you've got this wealth of expert knowledge that's been available, and SAGE themselves discussed travel restrictions in early February, and they noted that direct flights from China are not the only route for infected individuals to enter the UK. And with hindsight, we've seen that to be true. We now know that most seeding cases were in fact from Europe. So that we've got this expert advice that's telling us this. Quarantine measures for overseas travellers, however, as you'll be aware, weren't introduced till June time. And of course, there were still exempted countries, there was exempted people as well. Who was advising the Prime Minister and government to not close the borders, and on what basis?
So essentially there are two phases to this. I'd say kind of before April and then from April. Before April, the advice was completely to the, I mean, I heard this discussed several times with the Prime Minister in Number 10. he was told, we were all told repeatedly, the advice is not to close the borders, that essentially it would have no effect. At this time, I think another kind of sort of groupthink thing was, it's basically racist to call for closing the borders and blaming China and the whole China New Year thing and everything else. And that, in retrospect, I think was just obviously completely wrong. However, in some sense, in the same way that for lots of things you can't blame the Prime Minister directly, that was the official advice. The official advice was categorically closing the borders will have no effect. I inquired into it. I said explicitly, if we're not going to do it like Singapore and Taiwan and whatnot, we're going to have a bloody good explanation to the public, because they're going to be asking, why on earth are we under these restrictions, but you're not, but the borders are open? After April, though, it's a completely different story. Once we switch to Plan B, and right, we're going to build, we're going to do test and trace, we're going to do vaccines, we're going to try and stop the second wave, etc., etc. Fundamentally, there was no proper border policy because the Prime Minister never wanted a proper border policy. Repeatedly, in meeting after meeting, I and others said, all we have to do is download the Singapore or Taiwan documents in English and impose them here. We're imposing all of these restrictions on people domestically, but people can see that everyone's just coming in from infected areas. It's madness. It's undermining the whole message that we should take it seriously. And his basic argument at that point, he was back to lockdown was all a terrible mistake. I should have been the mayor of Jaws. We should never have done lockdown 1. The travel industry will all be destroyed if we bring in a serious border policy. To which, of course, some of us said, there's not going to be a tourism industry in the autumn if we have a second wave. Like, the whole logic is completely wrong. If we don't bring in a proper border policy now, and a bunch of other things, we're going to have a second wave in the autumn, and everything is going to be shut. Forget just tourism. But he was, he had the Daily Telegraph with their stupid campaign on the whole subject. He had Tory MPs going crackers about it at the same time. And essentially at that point, he was in, we should never have done lockdown, I should have been the mayor of Jaws, now I'm going to be, open everything up, get on with it. And me and others just could not win that argument. We never won the argument. As of today, look at the whole thing about variants. We still don't have a proper border policy, in my opinion.
Sorry. Is it a fair assessment to say that the economy and finance was prioritised over people's lives when we think about a border policy to encourage people to travel into this country, to spend money, to rejuvenate the economy? Was that prioritised?
Again, I would say you have to distinguish. It would not be fair to blame the Prime Minister for what happened before March, because all the scientific advice from SAGE and the DH was to do that. So I think you can't. He definitely was not prioritising tourism over the economy in January and February. I heard him say explicitly myself to the Science Advice and to the Department of Health, hang on, aren't a lot of people going to think we're mad not closing the borders? So the Prime Minister did push on that in January and February, and it would be wrong and unfair to say that he prioritised the economy at that point. However, after April, it's a different story, and at that point, yes, he was prioritising the economy.
Okay. So I just find this really interesting. So prior to my election, I was at a secondary school teacher. I taught modern studies and politics, and I specifically remember a lesson in early January 2020 when the first outbreak happened, or when we were discussing it in class. And I was explaining to my pupils that there's an area called Wuhan in China, this is happening here, and then linking it to what I teach. We spoke about if you were the Prime Minister or if you were a government advisor, what steps would you be doing to develop those critical thinking skills?
Yeah.
My 13-year-old brains understood the concept of closing the borders,
yeah,
or stopping people from entering or leaving the country.
Yeah.
If 13-year-old kids from Edinburgh could understand that, why is it a fair assessment then to say that the government well, 13-year-old kids were thinking more
Correct.
than government. Is that a fair assessment?
I think there's no. My perspective on it is that huge parts of the public health, if you just look at, this is sort of part of a general issue. Huge parts of the public health administrations in Britain and America were captured by memes which were obviously ludicrous. They said, don't wear masks, masks could be dangerous. Turned out to be complete nonsense. They said, don't close the borders. It's, as you say, common sense, obvious nonsense. It's just, in my opinion, it's unarguable that obviously we should have shut the borders in January. We should have done exactly what Taiwan did on whatever it was, New Year's Eve or whatever. We should have said, right, dunk, that's it. Yes, that has some disruption, but the kind of cost-benefit ratio is just massively out of whack. And at least it's worth a try. Like lots of things, at least you try it. If it doesn't work, what's the worst that's going to happen? If it doesn't work, okay, well, you've still got the whole nightmare to deal with anyway. But as it was, we were dealing with the whole nightmare. So there was just no fundamentally good logic to not shutting the borders in January, in my opinion. And there was never any logic to it after April. To begin with, the Prime Minister was confused, everyone was, everything was, as I described, was a nightmare. But from the summer, fundamentally, the view was, well, we're past it now, COVID's in the history, etc., which was obviously just a terrible mistake.
So leading on from that, leading on from that, during this point, the devolved nations were calling for tighter restrictions. The devolved nations were calling for tighter restrictions in terms of border control.
Yeah.
Who in the government had that responsibility of achieving a four-nations agreement on this?
I mean, essentially, the Prime Minister had responsibility for it, and there were numerous meetings in the cabinet room where it kind of percolated up through the system. Department for Transport was not keen on doing it either because they were all worried about the effects of tourism. Okay. But fundamentally, that decision was made repeatedly in the cabinet room in number 10.
And would you, or are you of the opinion that the views of the leaders of the devolved nations were listened to during this, specifically thinking about the border policy?
I can't really say if they were well listened to or not, to be honest. I mean, I can't really remember what they were saying, and I can't really remember much of the discussion around that question. Okay. I'm afraid.
Okay. One last question, if that's okay. So as I said, I'm a teacher, and you obviously have school inspections that happen. In England, it's Ofsted that run it. You've got 4 grades. So you've got grade 1 is outstanding, grade 2 is good, grade 3 is required improvement, and grade 4 is inadequate. How would you rate the government response on those 4 grades?
I would say some individual brilliant performances, overall system total failure.
Okay, so you give it a grade 4, inadequate? Yeah, okay, thank you.
Barbara Keeley.
Thank you. Mr. Cummings, I think what you've told us so far about social care is astonishing, but I'd like to ask some more questions about it, because clearly what we're talking about is hundreds of thousands of vulnerable people in care homes, 1.5 million care staff who, we're talking at the February-March time into April, were without PPE and testing. Now, you've said on social media that one of the worst failings was the almost total absence of a serious plan for shielding or social care last March. And there was a widespread delusion we had a great plan, it turned out barely to exist. Why didn't number 10 move quickly to protect care homes, which everyone knew would be vulnerable in an infectious outbreak?
So it was discussed, and we were told that people would be sent back to care homes after they'd been tested for COVID, and we were told that there was a plan for shielding. It turned out that neither of those things were correct. We didn't really understand the catastrophe around people being sent back to care homes who were already COVID infected until April. We realised the lack of a shielding plan roughly speaking, the week of the 9th. I organised a meeting on it in Downing Street on Thursday the 19th. And we looked at it then, and essentially we realised that yet again, as soon as you poked holes in things, there was nothing there. And essentially what happened then was that some officials said, there's basically nothing we can do. We haven't built the tools in advance. We can't get all these databases to communicate and whatnot. And this is where we're in this unusual situation of we're going to send out these shielding letters without putting in the helpline number, because the helpline number was basically not set up and they hadn't got a call centre to answer and everything else. And I said, and others said, well, what the hell are all these people going to do? I mean, we're telling them they've got to stay at home and that someone's going to help them, and they've got to stay at home, otherwise they're going to die. But we're not giving them even a number to call to say that we need food, we need medicines, we need other help. Like, what's going to happen to all these people? And essentially there was a lot of shrugging. And thank goodness, a group of officials, led by this great woman called Jen Allen, who worked at the Government Digital Service, she worked with a guy called Oliver Lewis, and they basically got a team together between the Cabinet Office and the Digital Service and CLG. And there was a brilliant spad in CLG called Olivia. She kind of got some people from CLG together and said, and they kind of jiggled together a team and said, right. And then they got a company involved and said, can you basically make all these databases talk to each other so that we can put the helpline out, and then people call up, we can take the details, and then we can get food delivered to them. And it was a bit of a similar kind of thing to the data between faculty and the NHS. Similarly, a company called, I think, Newton, but I might have got that wrong, worked with this team with Jen Allen, and they figured out a way to kind of bodge together these databases so you could start to do it. But it was all done essentially in literal all-nighters over the night of Thursday the 19th, over the next few days, to try and get this ready.
Okay, well, that's shielding, but I think the comment I read out to you that you've made was about social care as well. It doesn't appear there was any plan for social care. There might have been no plan for shielding, there was no plan for social care.
Fundamentally, yes.
In fact, it was reported in the media in March that you outlined the government's strategy in February, and it was said to be herd immunity, protect the economy, and if that means some pensioners die, too bad. That's in February. Was that the view held in government about the deaths of older people from COVID?
No, and also I never said that. It's that story in the Sunday Times had invented meetings on the 12th of an invented meeting on the 12th of March, which never actually occurred, as you can see from the Sage documents. It had an invented story about me in general and why I changed my mind and where I changed my mind and everything else. And I had this fake quoted. It actually caused huge trouble. I had people at my house threatening to kill me as a consequence of it. The journalist involved said afterwards it was the worst professional mistake of his career, but the damage was done, and it created this terrible impression that essentially we didn't care about people. Yeah, but it was not. It wasn't true.
We didn't care enough to have a plan for all those people needing care. We didn't care enough to have a plan for people in care homes or for people receiving care at home who necessarily had to have people coming into their homes or necessarily had to live in homes which are not generally suited for infection control. This is an infectious outbreak, and care homes, people coming in and out, they're working there, and they're visiting.
It's not just the view of me. I literally spoke to people who work at the Cabinet Office today who said, when I look back, one of the biggest things that it was just terrible is the lack of a plan for that. And
Well, let's just examine what happened then, because you talked about what happened on discharge. On March the 17th last year, NHS England wrote to hospital trusts telling them they could maximise bed capacity by discharging every patient they could safely discharge. Now, at that point, there was hardly any testing of those people. You've said that, I think you said that there was an intention to test, or it was said there was an intention to test, but it wasn't possible to test. On that major policy change of discharge, was that change discussed at meetings between NHS England and ministers and advisors? What were the views around at the time of the risks? Because surely somebody weighed the risks.
Yes, it was discussed. It was discussed in the Cabinet room in front of me and the Prime Minister and Secretary of State Matt Hancock and other senior officials.
And what were the views of the risks that were being taken by doing that?
As I said before, we were told that the people were going to be tested.
Right.
And we obviously discussed the risk. We were thinking, hang on, this sounds really dangerous. Are we sure? But it was kind of, well, there's no alternative because the whole original plan had gone so badly wrong. The view was, well, we've got to try and free up beds in the NHS to deal with the wave that was coming. So the view was, there's no alternative, but secondly, we were assured that the people who were being sent out would be tested. And as I said, it was only in April, after the Prime Minister and I had both ourselves been ill, that we realised that what we were told would happen never did happen.
Yeah.
Or only happened very partially and sporadically. At least, I mean, I'm sure some people were tested, right? But obviously, many people who should have been tested were not tested, and then went back to care homes and then infected people, and then it spread like wildfire inside the care homes. And also, the care homes didn't have the PPE that they needed to deal with it, and they didn't have the testing for the staff. So you had this kind of cascading series of crises, like domino effect rippling out through the system.
I think that probably wasn't seen until September, was it, that it would be staffed too. So in those discussions between the NHS England and ministers or advisors, you said it was discussed in the Cabinet room. What estimates were made of the impact of discharging positive cases? There must have been some estimates given, because clearly in a hospital setting, I think it's understood that NHS staff were infecting each other in hospitals, so there's going to be a level of infection.
Yeah.
What estimates were given as to the risks of that discharge?
I never saw any estimates about it. I think that in the conversations I saw, essentially the issue was just never properly it was never properly analysed or discussed in front of the Prime Minister and me, the Cabinet Secretary.
So that major change on discharge from hospital was made without evidence of the potential risks and of the potential numbers that may already be infected?
Well, it was made without a serious plan or capability to cope with the consequences, for sure.
Yeah. Why do you think nobody commissioned evidence on that topic? I mean, you said various things about the Secretary of State and about the state of the department. Is that the cause?
That's my assumption.
Would you have expected them to have commissioned evidence on that before they took that decision, before they put that decision out there?
Yeah, I mean, it kind of goes, everything's connected. It goes back to the whole disaster over testing. We didn't have enough testing, we didn't have enough PPE. Because we didn't have enough testing, enough PPE, then it wasn't provided to care homes. My impression looking back was that in the same way no one thought about how to produce the details of what to do on shielding, and therefore I had this terrible meeting on the 19th on shielding, I just think that the whole thing around care homes was the same. That just fundamentally it had never been properly dug into. And what happened was, in the crisis environment of complete chaos in that week of around the 16th, as we were heading towards lockdown, people just said, well, we've got no alternative than do this. And why on earth Hancock told us that everyone was going to be tested, I've absolutely no idea. But we all now know that it definitely didn't happen.
Who was there when he told you that?
I can't remember everyone, but it was a formal, like all of those meetings. We stopped doing the meetings in Cobra, and from kind of the week of the 9th, the daily COVID meetings were all in the Cabinet room. So often, don't get confused. Cabinet was essentially not really relevant to any of these things in the March period. When I say the Cabinet room, I'm not referring to Cabinet meetings at all. Often the only people there were the Prime Minister, Hancock, and then occasional other ministers that were relevant to that specific thing. So this meeting was PM, Hancock, Cabinet Secretary, me, bunch of number 10 staff, some DH staff, other people on Zoom. Possibly Simon Stevens there, possibly not, I don't remember now.
Okay. Looking back at the whole thing then, after COVID was seeded into care homes, do you think... Looking back now at what we're just discussing, after COVID was seeded into care homes, do you think the government, including SAGE, was taking that risk of transmission into care home settings as seriously as they should? And I want to look at this in the context of what you said since. Was it the start of the thinking by the Prime Minister that has been reported as COVID is only killing 80-year-olds? Was there a sense that it kind of didn't matter because it's people at the end of their lives and it just didn't matter?
So it's two different questions there. Your first question, I think, was essentially, was this taken seriously, properly, and everything else by Number 10, etc., etc. The answer is obviously no. It wasn't. It was not thought through properly. There wasn't any kind of proper plan. It's clear in retrospect that it was just a completely catastrophic situation happened with these people being sent back untested and then seeding it in care homes. I think there's no other way to describe it than that. You know, like all of these things, I don't. You know, it wasn't deliberate. It was just. It was a function of the overall fact that the system was just completely overwhelmed. The Prime Minister's views on COVID and who it had killed was relevant, but that was relevant in September, October. It wasn't relevant to this point now.
Okay, thank you.
Dean Russell. Oh, I do apologise. It's Luke Evans next. Apologies, Luke.
Thank you, Chair. One thing we do have control over in an emergency is the way in which we communicate. Arguably, that's your strongest suit, given your track record with Brexit. What would you score the government out of 10 on its communication, both to the NHS and to the public? 10 being this is gold standard, or 0 being the lesson learned, we should never do this again.
I think that so some of the people working on the communications were some of the best people in the world, and one of the great myths about the whole thing is that the reason for all of these problems was bad communications. Fundamentally, the reason for all these problems was bad policy, bad decisions, bad planning, bad operational capability. It doesn't matter if you've got great people doing communications if the Prime Minister changes his mind 10 times a day and then calls up the media and contradicts his own policy day after day after day. You're going to have a communications disaster zone. A few things are discussed more inaccurately than communications. So inevitably, there were certainly mistakes made on communications for sure. But all the big things that people think, why did that go wrong? Why did that go wrong? Like for example, the whole thing with Rashford. The Director of Communications said to the Prime Minister twice, do not pick a fight with Rashford. Obviously, we should do this instead. The Prime Minister decided to pick a fight and then surrendered twice. After that, everyone says, oh, well, your communications are stupid. No. What's stupid is picking a fight with Rashford over school meals, and what should have happened is just getting the school meals policy right. So it's easy to blame communications for bad policy and bad decision making.
Let me pick you up on that, because no plan, stands the test of time when it hits the enemy. This was a novel virus, but the benefit you have in communications is we went into a second lockdown. So what were the lessons learned from communicating in the first lockdown that came out to play in the second lockdown? And looking at that, there was a third one which you weren't involved in, but I'd be interested in your lessons learned, because that's what the essence of this inquiry is about.
I think the same thing happened in the autumn as happened in January. It was bad policy and bad decisions. The problems in the autumn were not fundamentally communications problems. They were that the Prime Minister made some terrible decisions and got things wrong and then constantly U-turned on everything. That's not a communications failure. You see it, everyone in the outside world sees it as a communications failure, but the reality is it's much more fundamental than that. the autumn disasters were fundamentally not communications problems. The communications problems were a consequence of bad decisions and bad management.
So were you in charge of the communications at this point? Are you saying this isn't my problem, Gov, it's what I was given?
No, I mean, as I said earlier on, I had the only time between the election and leaving Number 10 that I was really engaged with communications at all was the period kind of late February until me and the Prime Minister becoming ill being tested positive on the Friday. That kind of 3 to 4 week period. Both before that and after that, I was very little involved with communications because I fundamentally disagreed with the Prime Minister on what is good communications, how to do communications, how it should be structured, how we should approach the media. On pretty much every single major thing, he and I completely disagreed. So I tried to use my time where I thought it could be better spent. For example, in the autumn, I spent, literally near zero time on communications and huge amounts of time on mass testing and on the defence review and on the economy and other things like that, procurement reform, etc., etc.
How well were you involved in the lockdown measures draw up, and what was your understanding of the lockdown measures?
Which one? Sorry, which one are you talking about? In March or?
First one.
I was heavily involved in the period between. If you're talking about the communication of the lockdown measures, kind of between trying to formulate Plan B on the 13th and then actually doing lockdown 10 days later. Do you mean then?
Well, the understanding for the public when the measures came out over what's involved in what you can do, why we keep 2 meters apart, who can go to what, when we can go to school. What understanding did you have that of where we could travel?
Yeah, I was heavily involved with that, but again, the problem there was not. I had all the communications people were screaming. We haven't got anything to explain to the public properly, or what we have got is all contradictory because we haven't got an actual plan. That was the problem. The problem wasn't in the communications team. The problem was what they were being given.
Okay. Moving on to a second point, and it's to pick you up on your evidence you gave at the start. At 11:09, you said to the member for Salford and Eccles, "It's completely crazy that I should be in such a senior position." You also then said you realised this was a massive problem, and yet you didn't take action. Why didn't you resign straight away? Or why you had the power to hire? Why didn't you hire your replacement? And did you say to the PM that you didn't feel you were competent?
So I did hire various people into Number 10 to try and raise the quality of the team there.
Hello everyone, how's it going? Steve here.
For example, bringing in people like Tom
You are
Shinner.
watching
We
the
built
Dominic
the
Cummings
analytical private office in there.
Science and Technology Committee.
There were lots of
and
different people I
Social
brought
Care
in to try
Committee.
and provide
Questions
expertise and skills
on
that I
lessons
didn't
learned
have
during
and
the
which also
COVID-19
didn't
pandemic
exist
in the UK.
in
The
Number
stream
10.
will continue until the
And,
very end, so stick with it. Remember
that
and hit
did actually
subscribe.
help. So in
And if you want
January,
to watch
when I
part one
did
of
that
this,
vlog
you can
saying
find
that Number
this
10 doesn't
on
have
the
these skills, we need
channel
to
as
hire
well.
people.
As well as
By
today's Prime
September,
Minister's
we
questions
had built
live
that
in
team,
full.
and it did make a huge difference.
So,
and I think we'll come
if you've
on
had
to
enough
in
of that,
terms
go and
the
watch this,
September
or
decisions.
after this, go and watch that.
Terrible
Thank you.
decisions were made, but they were made for completely different reasons than they were made in March. By then, there was a different set of skills and a different set of people. In terms of why should I have resigned, as I said, arguably I should have resigned in March. Arguably I should have resigned in May, and I should definitely have resigned in September.
So in answer to that question, I'm just wondering where you draw the line on your personal responsibility in the decisions that are made. You said you didn't speak up because you were worried about the fact that you might be getting it wrong and people may die. There was a certain infamous trip, and that had huge influence on how people perceived the lockdown. Again, you said it was the problem of the policy, not in the way in which it was messaged across. Where do you draw the line for you having personal responsibility for the decisions both in government and about the way you conduct yourself?
So I think I should probably explain some things about this that were not put into the public domain at the time in the Rose Garden. because that whole episode was definitely a major disaster for the government and for the COVID policy. So I'll explain something about it and then and why we got things so wrong. In autumn 2019, I had to move out of my house because of security threats for about 6 weeks. On the 28th of February, when I was dealing with the COVID problem, on the Friday night, I was down in Westminster, and my wife called saying there's a gang of people outside saying they're going to break into the house and kill everybody inside. She was alone at the house at the time with our then 3-year-old. After that, I spoke to the PM and the Deputy Cabinet Secretary, Helen McNamara, about the situation, and it was suggested that possibly I either move my family into a government accommodation or move them off to family. On the 22nd of March, the story happened which the lady mentioned earlier about that fake quote from me, basically implying that I was happy for everyone to die, which led to further problems. After that weekend, I then said to my wife, right, we've been discussing it for a month, we've got to get out of here on Friday. So before the whole thing happened with the Prime Minister being sick, my wife calling up on the Friday and everything else, it had already been decided that I was going to move my family out of London, regardless of the COVID rules. That was discussed with people in the Cabinet Office and with the private office. Now, what happened is, because of this, we kept the whole thing very quiet. Almost nobody in Number 10 knew about it for obvious reasons, because I didn't want the same problems to pop up at my parents' house up in Durham. When the story then came out, the Prime Minister and I agreed. When the first story came out about me, much of the story was completely wrong. It suggested that the police had spoken to me about my behaviour because of the lockdown rules and whatnot, which was completely false. The police had only spoken to me about security issues, but the media presented it as if I'd been talked to by the police for breaking lockdown rules. The whole story was crazy. The Prime Minister and I agreed that because of the security things, we would basically just stonewall the story and not say anything about it. And I was extremely mindful of the problem that when you talk about these things, you cause more trouble for yourself. And I'd already put my wife and child in the firing line on it. So I said, I'm not talking about this, we should shut our mouths about it, and the media stories are all basically, loads of it is wrong, and ignore it. Prime Minister agreed. Then on the Monday, he was under so much political pressure and media pressure that he said, this line won't hold, we're going to have to do something about it. Now at this point I made just a terrible mistake, which I'm extremely sorry about. What I should have done in retrospect is I should have called my wife and said, listen, you and our boy are going to have to get out of London again. I'm going to have to just explain the truth about this whole thing. Get out of London, we'll hold a press conference. Instead of that, we had a kind of chaotic situation in Number 10 where the Prime Minister said, we're going to have to do something, you're going to have to explain something. And I said, I'm not explaining these security things, otherwise I'm going to have everyone mobbed back outside my house. So I ended up giving the whole Rose Garden thing, where what I said was true, but we left out a kind of crucial part of it all. And the whole thing was a complete disaster. And the truth is, and then it undermined public confidence in the whole thing. The truth is, when the Prime Minister said on the Monday, we can't hold this line, we're going to have to explain things, if I just basically sent my family back out of London and said, here's the truth to the public, I think people would have understood the situation, and it was a terrible misjudgment not to do that. So I take, the Prime Minister got that wrong, I got that wrong. We both made a terrible horlicks of it in a very odd circumstance on the Monday. So that hopefully explains that situation and makes clear that I know that my misjudgment on it caused huge trouble. And I deeply apologise for it.
Thank you, Mr. Cummings, and I'm sorry that you felt threats to your family and indeed to yourself and your safety. No one should feel that. However, this is about lessons learned. One is they're talking about coming forward and giving the truth. The second is, with regards to that, where do you see your personal responsibility on this, the media's responsibility on it, and government's responsibility to looking after the people who are being representative and making these tough decisions in a world emergency?
Do you mean specifically on this particular episode, or do you mean in general?
Yeah, this particular episode, because what we don't want to happen is something like this happen again that undermines public confidence. If there's ever to be another pandemic, we need to learn the lessons so that these situations are avoided.
I think a fundamental lesson of it is the same as the fundamental lesson on Sage and so many things, that openness is better. Like, essentially, we took the decision because of the security problem, and I didn't want to go through the whole thing of moving my family again and everything else. And I felt guilty about the whole thing as well with my wife. Fundamentally, that was a terrible, terrible mistake though. It would have been much better just to come clean on the whole thing, tell the truth about it at the time, and then I think it wouldn't have been the fiasco that it became. So I guess the fundamental lesson is the default on everything should be openness. If we defaulted to that on this, it would have been harder for me in some ways, but it would have been better for the country, and that's what we should have done.
Thank you, Luke.
Thank you very much, sir.
Obviously, it is totally and utterly unacceptable that you or your family should face threats, but there's just one thing I didn't quite understand in your narrative. If you were moving your family out of London for security reasons, why did you move them back?
Because essentially, I've been on, during that time in that next 2 weeks, I've been lying there thinking that I might die. I was extremely ill. On the 12th, the day before we came back to London, I could still, I could really still hardly walk 50 metres. And if it had been up to me, I would have left my wife and child behind. But she was extremely worried about me. She was worried that, what happens if I just collapse at home? I'm by myself. Who knows what state you're in? The medical advice was that I shouldn't be basically rushing back to work. I should stay and rest. But the Prime Minister literally nearly just died. I was getting all these messages from everybody saying that the government's in free fall. If you can get back, you should go back. So I went back. She was worried about me, and therefore she made the decision. I'm going to come back with you. We all had to make very difficult decisions at this time. If I could have done, I would have left them in. I would have left them in Durham, frankly.
Thank you, Dean Russell.
Thank you, Chair. If you don't mind, I'd like to explore this a little bit more, but with the Durham trip, and I'd also echo the comments about the awfulness of having security risks to your family. That's just never acceptable. But a lot of the issues around messaging was about trust in the messaging from government, the trust in you and in officials, and in particular around behaviour change. And most of the messaging during that time were 3-word statements. There was stay at home, there was protect the NHS, more recently hands, face, space. And I think the nation just wanted to hear one statement from you, which was a 3-word statement, which was I am sorry. And I just want to understand, Mr. Cummings, why you just didn't apologise when you were in that rose garden.
Because, as I think I've tried to explain, there were sort of multiple things going on in my head about it all. I couldn't really tell the whole story about it. Or I felt I couldn't. I should have done at the time, but felt like I just didn't. For the reasons I've described, I think that my behaviour in leaving London at the time was perfectly reasonable. And other people in the Cabinet Office and the Prime Minister and everyone agreed with me that it was reasonable for me to move my family out of Durham. So I was caught in this thing of, well, are you going to apologise and say it was a terrible mistake? The truth at the time was, no, I wasn't sorry about moving them out of London, and I didn't think it was a terrible mistake. I thought it was completely the right thing to do. But the problem was we were trapped in a situation where I was only telling part of the story. So the whole thing was just a complete disaster.
And with regards to that, though, what was
obviously I am extremely sorry about the whole thing, the way that the whole thing worked out, because the reality is I had all the security problems again afterwards. Twice further, I had to move my family out of the house again because of problems at the house, despite the COVID rules. I stress for all the journalists watching, the further stories about me going back are false. It is true that I moved my wife and child back out of London, despite the COVID rules, but that was in discussion with the police. I did not leave London. And all of these stories about me being elsewhere and me going off whatever, those stories are all categorically false. But it is true that I've moved my family out again. So the problem is, the truth is I had all these problems again anyway. I didn't dodge them, and that's why it would have been better just to explain it all the time, and I'm extremely sorry that I didn't.
Why is it taken till today, though, to make that? And I can really sympathise with the issues for your family and so on, and appreciate that. But why is it taken to this committee to hear you actually apologise in hindsight, given the fact that I think an apology at that time would have lifted a lot of the pressure? Because I think the nation's back was up over it because they felt that, rightly or wrongly, that you'd sort of done it and you sort of said, look, that was the right thing to do, move on, whilst everyone else in the country was following the guidance and not getting to go to funerals, not going to see their families, not hugging their family and friends, and worried about their lives. And the presumption, especially the press, was that you'd sort of done it and didn't really have an apology to give.
Well, I mean, I did understand at the time, and I do understand at the time, you know, people talking about, you know, people being very upset and their relatives. My own uncle died while I was in bed with COVID. My own uncle died in hospital of COVID because of this whole problem about hospitals and infection in hospitals and whatnot. So I very much did understand people's anger about it. All I can say is, after the complete debacle around the whole thing, it just didn't seem like coming out and then trying to explain it all while I was still in government was a sensible thing to do. And then after I'd left, it's kind of, the last thing I wanted to do was draw attention to the whole thing, and to my house and everything else. Again, as it is, again, I've had to move, I've moved my family out of the house now for this whole public thing. I've got the whole street has got cameras and everything else around it, but I figured that today is today's the day for just getting the whole terrible story on everything out so everyone knows the reality. And hopefully this is a case study of how not to handle something like this. As I said, it's clear in retrospect that once it was clear that the Prime Minister wasn't prepared to hold the line, I should just have said, right, family out, I'll explain the whole facts, and that's it. And I think most of the country would have understood it. But we kind of just did the worst of all possible worlds.
And with regards to that, did everyone in government and Number 10 appreciate the real sheer emotion of the country at the time? I mean, in my constituency email box, we had 1,000 emails from people really angry about this. Was there a realisation of that disconnect?
Yes, we knew as soon as the whole thing had happened, we knew I knew that the whole thing was a complete disaster.
And do you feel that you were unfairly targeted by the media? It felt to me that during that time there were quite a few cases of high-profile individuals breaking the rules in various forms, whether it be the blurry edge of it or completely. Why do you think you were targeted so much by the media over a very sustained period of time?
I mean, I've never complained about the media, or I've never threatened to sue the media. I think if you're someone like me who's in the public eye, and you say, as often as I have over the last 20 years, that as many critical things as I have about the media and how they cover important stories, then they're going to throw things back at you when they've got a chance to. Also, fundamentally, a lot of the media realised that there was a kind of tension in Number 10 between me and some of my team that wanted to try and change the culture of Number 10 away from what it's been for 30 years, which is essentially a press answering service where everything is dedicated to the media day in, day out. I regarded this as a disaster, and I wanted to try and move the whole culture of governing away from that. And there was huge tension because the Prime Minister's view is literally, you couldn't get a more diametrically opposed perspective on it. For him, he just gets up, reads the papers, says, right, what are they doing today? And then cannons around. And the media realised that there was this tension going on and that I was essentially trying to massively diminish their influence, and therefore they wanted rid of me. And so from their point of view, rationally.
Okay, no, thank you for that. Just in relation to the Rose Garden Downing Street, the press conference there, you've made some very, very big allegations today, and we're yet to see the evidence and the emails and so on. And you've raised on several occasions that around that time, prior to that time, actually, March, February, you had very serious concerns. You had the UK's media in front of you, in fact, some of the world's media. Why didn't you raise some of those concerns then, given the fact that you knew in your mind, from what you've said today, that many lives were at risk?
Do you mean, why didn't I speak to the media and say, I think the government's plan might be disastrous?
Yes, or variations of that, because you're making those suggestions now, a year later again, after the horse has bolted, if that's the case. Why didn't you use that platform at that time to say, look, I've got grave concerns, we need to change direction?
Because I thought the right thing to do was to try and make the arguments internally and change the Prime Minister's mind and change the official plan and kind of shift it from plan A to plan B. I think if I had suddenly started calling the media in the week of the 9th, so as I started having meetings with people in the 9th on plan A is a disaster, we've got to shift plan B, if I then started calling everyone in the media and saying...
Sorry, not calling, but you were in the Downing Street garden, you had what I felt was a bit of a witch hunt approach of one journalist after the other asking you a question after a question, but there was a platform there for you to say, I'm really concerned that lives are at risk, that we should be changing things. What was your decision to not raise that in public at that time, given you're now saying that you had major concerns?
Well, it's a kind of constant problem that people like me have to wrestle with all the time. That other people in this room will have wrestled with. It's the tension between, if you threaten to resign, you've got to be serious about it. Otherwise your bluff is called. If you leave, then you lose basically all control, unless you're going to put a gun to someone's head publicly. If you stay, then you've got a chance to try and influence things. I thought at the time, as I said, I thought very, very seriously about resigning in the summer. I was dissuaded from doing so by the Cabinet Secretary and by other senior people who said, please stay, don't do it. You have that tension, and I don't know quite what... So I think in retrospect, I was probably right not to resign in March. I think in retrospect, I was definitely wrong not to resign in September. Whether or not I should have gone in the summer or not is, I don't know.
But you mentioned there about tensions between decisions, and what we've heard this morning is that you said that you had no real power, yet you took the test and vaccination programme off the Secretary of State. You had major concerns a year ago but didn't raise them in front of the media when you had an opportunity. You were concerned about making decisions that would put people's lives at risk, yet you took a trip to Durham, which I appreciate you've explained in more detail now. Do you get that there's listening to this for the past 3-4 hours, that there's sort of you didn't have any power, you didn't have any control, you had the ear of the Prime Minister but didn't really use it, and yet on the flip side you were able to make things change. I just think from a perspective of decision making, it just something doesn't connect there for me.
Well, I think all people all over Westminster exaggerated. I think arguably they underestimated the influence that I had between July and December 2019. Arguably, they massively exaggerated the influence that I had after the election. The whole idea that I was the second most powerful person in the country and all of that, and I could just click my fingers and do this and do that and do the other, was just completely wrong. If I could have clicked my fingers and done things, there would have been a serious border policy. Masks would have been compulsory. Hancock would have been fired. We'd have done, dozens and dozens and dozens of things. What happened is, fundamentally, the Prime Minister and I did not agree about COVID. We did not agree about COVID after March. After March, he thought the lesson to be learned is we shouldn't have done a lockdown, we should have focused on the economy, it was all a disaster, I should have been the Mayor of Jaws. I thought that perspective was completely mad. I had very little influence on COVID stuff. I mean, I tried, I made arguments, but as you can see on pretty much all the major arguments, I basically lost, did not win. What I therefore did in the summer was I brought in Simon Case to be the Permanent Secretary at Number 10 because I thought the Prime Minister's not listening to me on this whole subject. Our relations are getting worse and worse. His girlfriend is desperate to get rid of me and all my team. If I bring in someone official to try to take over on COVID, that will A, make things better, and B, maybe you'll listen better to Simon Case than you will to me, which to some extent did happen. And then I spent a lot of my time in kind of May, June, July, not on COVID, but on defence, science and technology, procurement reform, planning regulations, the economy, productivity, innovation, data, all of the civil service, all of these sorts of things. And I tried to use what influence I had on those things where either the Prime Minister agreed with me or he didn't really care, in which case I could push things on. But it wasn't really useful me just sitting in meeting after meeting on things like quarantine, where he just didn't agree.
So just for my final question, sorry for the time taken, Chair. For lessons learned moving forward, it sounds like you were perceived to be, the chief advisor, whatever the title may be, to the Prime Minister, but your advice was not being taken. And was that because of the fact that you didn't bring people along with you to agree with your advice to then have that to get the Prime Minister to listen? What was the reason for that? Because the bit that comes to my mind is that if we go into another pandemic in a few years' time, how do we set up the structures according to what you're saying today to make sure that advice is listened to? Because ultimately, shouldn't you be effectively the canary in the mine to be able to say, actually, there's stuff coming down the line that we need to do something on? And it sounds like your advice, from what you're saying, was not taken on board, rightly or wrongly.
So I think it's hard to sort of generalise about some of these things. I think on lots of stuff on COVID, actually there was a centre of gravity in Number 10 for the same view around that agreed with me, but the Prime Minister just wouldn't do it. On many issues, me, the Cabinet Secretary, the Chancellor, other senior people agreed, but the PM just wouldn't do what we advised. So the problem wasn't necessarily I couldn't persuade other people on lots of things. Everybody was screaming on quarantine, have a policy and set it out clearly and stick to it. We cannot keep changing your mind every time the Telegraph writes an editorial on the subject. Everybody agreed with me about that, regardless almost of what they thought the real policy should be. But nobody could find a way around the problem of the Prime Minister just like a shopping trolley smashing from one side of the island to the other.
Well, interested to see the evidence. So thank you. Chair.
Thank you. Just before we move on from this, with respect to Barnard Castle, one of the things that really upset people wasn't taking your family out of London. It was that trip when you were up there that you said was to test your eyes, but others said was actually a birthday trip for your wife. Do you stand by that account?
I think if I was going to make up a story, I'd have come up with a hell of a lot better story than that one, right? I mean, it's such a weird story that, the truth is, only a few days before then, I'd been sitting in bed writing, a will, what to do if I die. I then was thinking about coming down on the 12th, the Sunday, but I was basically too ill to do that. My wife said, look, you're in a state, you can barely walk, are you sure you're okay to go back to work? Are you sure you're okay to this whole thing? And I don't know, I try to explain this all the time. It seemed to me okay, if you're going to drive 300 miles to go back to work the next day, then pottering down the road for 30 miles and back to see how you feel after you've just come off what you thought might be your deathbed didn't seem crazy to me at the time.
Did it not seem crazy to do that test with your wife and child in the car with you?
No, it didn't. Didn't seem crazy.
Does it not seem a bit crazy now?
Let's get in the...
That you are testing your eyesight with your wife and child in the car with you?
It didn't seem crazy at the time. It seemed just like, okay, let's get in the car, drive up and down the road. If I feel bad, come home, see how I feel as I get going.
Okay.
But I can completely understand that. I can completely understand why why people think the whole thing was weird. And obviously, I wish I'd never heard of Barneycastle, and I wish I'd never gone. And I wish the whole nightmare had never happened. But hopefully, people can even if they don't agree, hopefully they can understand. As I say, I can only apologise for the whole debacle.
Okay, we have talked a lot so far about things that went wrong, but I think we should spend some time on the big thing that went right, which was the vaccine programme. And I've got three colleagues who want to ask you about that. But just let me open by saying, what is it that you think we got right on the vaccine that was so different to some of the other things that we've been talking about today?
I think fundamentally on vaccines there was clear responsibility. There was someone who was actually in charge of it, Kate Bingham, and she was working with Patrick Vallance. She built a team of people that actually understood what they were doing. And she had the kind of strength of character not to be pushed around by... So we had a kind of formal thing which was, you're in charge of it, you report basically directly to the PM. You don't report to the Department of Health. So she knew kind of who her boss was on it. The built a great team, and we also said to her, treat this like a wartime thing, ignore rules. If lawyers get in your way, come to us, we'll find ways of bulldozing them out of your way. And it just, clear accountability, people that really understood what they were doing, relative to almost everything else in Whitehall, extremely low friction, and some great kind of technical help. I think those things, when you put them together, meant that it worked better than pretty much anything else. I think this is not in any sense a comment on Kate. I think the fact that it works out relatively well to the rest of the world, though, shouldn't blind us to the fact that we only really got that going. So I think my first conversations about the idea of it with anybody were in March. Patrick Vallance texted me on roughly the 24th, I think it was, of March. Something like that. I've got the exact date. Like lots of other things, though, there's no doubt that we could actually have done this faster than we did. The conventional wisdom was we're not going to be able to have any vaccines by in 2020. Now, in March, I started getting calls from various people saying these new mRNA vaccines could well smash the conventional wisdom, don't necessarily stick to it. People like Bill Gates and that kind of network were saying. So essentially what happened is, there's a network of people, Bill Gates type people, who are saying, completely rethink the whole paradigm of how you do this. Build in parallel, here is the science thing, here is the manufacturing thing, here's the distribution, here's the supply, here's logistics, here's the data. The normal thing is you kind of do those sequentially. What Bill Gates and people like that were saying to me and to others in number 10 was, you need to think of this much more like some of the classic programs of the past, the Manhattan Project in World War II, the Apollo program, build it all in parallel. Now, in normal government accounting terms, this is completely crazy, because if nothing works out, you've spent literally billions building all of these things up, and then the end result is nothing, you get zero for it, it's all waste. But what Bill Gates and people were saying, and what Patrick Vallance and Patrick's team was saying was, the actual expected return on this is so high that even if it does turn out to be all wasted billions, it's still a good gamble in the end. And all the conventional Whitehall accountancy systems for this can't basically cope with it. You've just got to throw them all down the toilet. And that is essentially what we did. Patrick came to me and said, I want to do this. I think we must take it out of the Department of Health. Bear in mind, this was at the time we were having all these conversations about PPE, about testing, about shielding, about all the things we've gone through today already. with all of these different things being wrong, Patrick said, take it out of the Department for Health. Will you support me on that with the PM? I said, absolutely damn sure I will. I spoke to the Cabinet Secretary. The Cabinet Secretary completely agreed, because also he was watching all of these meetings in April about all the problems the DH had. So weirdly, this was one of the things that actually had almost no real formal meetings and actually very little discussion. Patrick, me, and Cabinet Secretary all basically went to the Prime Minister when he came back from being ill and said, there's just no alternative. We've got to do it like this. It's inconceivable we can leave it in DH. Here's the structure. And the Prime Minister just decided in about 90 seconds, fine, do it. And that was it. And there was basically not really any formal structure. There was a little bit of whinging here and there there's a little bit of pushback in some quarters saying, this is extremely risky. If you don't go down the EU approach and that works and we do it ourselves and it doesn't work, you guys are all going to be in a huge political hole.
But you have to take risks.
But you have to take risks. And when we looked at the EU plan, not just me, but all the people that really understood vaccines and some procurement experts that we asked to look at it all said, well, the EU plan just looks like the classic EU Brussels thing. It's going to be completely bogged down in bureaucracy. They're not going to be able to take the right financing decisions. They're not going to do this parallelism approach of building everything and subsidising everything as you go along. So it seemed at the time like that was just clearly the right thing to do. And thank goodness that was one of the few things I think that we got right.
Thank you. Let me bring in my colleague Zara Sultana.
Thank you, Chair. I was meant to come in earlier, but I had a PMQ, so I'm not going to go entirely on vaccines at the beginning. I just want to pick up on some points, Mr. Cummings, that you made earlier regarding herd immunity. You said that it was an unavoidable fact and it was the official plan of the government. Did the Prime Minister specifically acknowledge that pursuing this would result in an excess of 500,000 deaths, and was he okay with that death toll or a death toll of that margin?
So the Prime Minister was definitely aware that as I said earlier on, that herd immunity by September in a single wave was the official plan A. That's on the COBRA document that I shared with you as it's described, the optimal single peak strategy. On the 12th, the Prime Minister, like me, heard in the conversation about chickenpox parties and the interviews that a few people gave about herd immunity, and the Prime Minister, like me, started to think, hang on a second, this sounds at best extremely frightening. Is this really what we're going to do? But as I said, up until when we had the meeting on the 14th, the whole point of that meeting was, here is the real numbers on what the herd immunity by September strategy really means. It's on the best case 260,000 people dead. On the DH's own thing, we can't do that. We just can't do it. We've got to gamble on an alternative plan. But at that point, remember, the conventional wisdom was, if you do gamble on an alternative plan, it's not going to be 260,000 people dead. It might be 2 or 3 or 4 times worse than that in the autumn. And that was the whole argument that kind of played out between the night of the 13th and when we decided to lock down by kind of the weekend of the 18th, 19th, 20th, the back end of the following week. But it's completely bizarre. Everybody knows the Secretary of State for Health, the Chief Scientific Advisor, the Chief Medical Officer were all briefing Laura Kuenssberg, Robert Peston, all the key media people in the week of the 9th on single peak herd immunity by September plan. It's totally bizarre and incomprehensible to me that the government that Number 10 would now be trying to deny that when it was officially described. It's on all the official documents, the CSA, etc., and people from Sage all said it on TV. And the Cabinet Secretary described it as the chickenpox parties thing on the 12th. That was the whole... So I'm completely baffled as to why Number 10 is now trying to deny that was the plan. The whole point is that was the original plan, but we realised what the consequences of it were going to be, and we decided that it was intolerable and we had to try and try something else.
This issue and the issue of whether the Prime Minister's inactions have led to deaths was asked at PMQs, and the Prime Minister said that all of these matters will be reviewed in the course of a public inquiry, which will start next spring. You've already said that that would be too narrow in scope. Do you support the calls of bereaved families for a statutory public inquiry that's independent and led by a judge?
I don't know about being led by a judge, because often these judge-led things actually don't, the history is they often don't really get to the bottom of it.
Hello everyone, how's it going? I hope you're enjoying the Dominic Cummings being questioned by Science and Technology Committee and Health and Social Care Committee. It has been very interesting to watch. This is just a
tens of
quick
thousands of people died
heads
who didn't
up.
need to die.
In around
There's
half an hour,
absolutely no excuse
this part of the
for delaying
session
that,
will be
because a
completed.
lot of the reasons for why that happened are
this
still in place
stream
now. Look at the whole debate about variants and whatnot. Like,
aired on like a 30-minute
this
delay.
has to be honestly
You won't need
explained.
to worry
If
about the
government,
adjournment.
Number
Once
10
the
today
adjournment
won't
happens, we
tell
will
the
just
truth
skip
about the official
directly
plan, which they briefed
to
the
when
media about
part
and
three
described on TV
comes on. So you
a
don't
year
need to
ago.
go anywhere.
What
When
on
this
earth
part
else
of
is
the
going on
sitting
in there
finishes, which
now?
will be in around half an hour's
So
time.
yes, I do,
Just sit
and I
tight,
also think,
and the next
you know,
part will be right
if
on
you go
after.
back, and I do, this is
Got
not
your
about
back.
dragging Brexit into
Take it
anything,
easy.
but if you go back 2 years, if MPs could seize control of the legislative programme and say, we are in charge, not number 10, when it came to Brexit and the second referendum, why on earth can MPs now not take control and say it's intolerable that this can be delayed? The elected representatives of the families of people who died who didn't need to die must get to grips with this now. There is absolutely no excuse for delaying it. And the longer it's delayed, the more people will rewrite memories, the more documents will go astray, the more the whole thing will just become cancerous.
One of the issues has been the Prime Minister's reluctance to actually meet the COVID family group, the bereaved families. Why is the Prime Minister running away from meeting with them, do you think?
I can't imagine why.
Okay, I'll move on to my question about contracts. So Byline Times and the Citizens Overview of Contract Awards reveals that a year after the first COVID lockdown, almost £1 billion in government contracts has been awarded to 15 firms that linked to Conservative donors, and they've had more research that continues showing this trend. During your time at Downing Street, was there concern about the contracts process, that it wasn't fair or transparent, and was anything really done to address this?
Initially, there wasn't initially in kind of February, March, no. All of our concern was just this disaster coming at us, and my concern was all the kind of blocks in the procurement system and us not being able to do things like sign fast contracts with testing companies to get testing ramped up when PHE didn't have the capability and stuff like that, and PPE. So I would say January, February, March, my concerns and most of the concerns in number 10 were really about capability and speed and buying what we needed and getting PPE to the front line and things like that. Later on, there were concerns, yes, because various stories started to come out into the media about what was happening, and then we suddenly started reading things about VIP channels and whatnot, and what were these VIP channels and who was in charge of them and how had that all been done. But that didn't really cross my radar until, I can't really remember, but I would guess probably something like May or something. Not in the first phase for sure.
In terms of some of the contracts, a contract with a jeweller worth £70 million for sterile gowns, almost all of them couldn't be used because the contract didn't request double packaging. Another contract for face masks, completely unusable because they had the wrong type of fitting. In terms of some of these mistakes, the government have said, we were in a panic situation, we just had to order things. In hindsight and going forward, what kind of processes do we need to make sure that we're not throwing millions, if not billions of pounds, essentially down the toilet for wrong items?
So I think I won't bore everybody with going back through the history of this, but I said many times before, including actually, well, I won't go into that. Many times before, that the procurement system is completely unfit for its purposes in Whitehall. Ironically, in January and February, when I should have been paying far more attention to COVID, one of the big issues, all this media stuff about culture wars and whatnot, I had literally zero to do with any of that nonsense. One of the big issues I was dealing with in January and February was this procurement thing, and I was bringing in outside experts. There's a guy at Oxford called, he's got a very, very hard to pronounce name, Ben Fidgenberg, I think you say, to try and address this problem of how do you get a serious procurement system. The problem is that we just didn't have time to sort this out before the crisis hit. The fundamental thing is that there needs to be a legal, proper, emergency, fast-track process. And there needs to have people with the skills to execute that at speed and at scale. And a fundamental problem that you had in February, March, April was you had a legal structure with a whole bunch of horrific EU laws, and then you had a whole bunch of horrific Whitehall gold plating on top of that. And then you had a set of officials who'd only ever worked inside this system. And then you had this completely unprecedented crisis. And then you had people like me shouting, call the airlines, tell them we're taking their planes, we're flying them to China, find the nearest airfield, throw the PPE in the back, fly it back now. There was no system for doing anything like that at all. So everyone was just kind of like, can we do that? Is it legal? What happens if we do it and then everyone starts suing us, etc., etc.? So the obvious lesson, and one of the things that I spent my time on in the summer and autumn was changing the legal, combination of changing the legal framework and changing the kind of recruitment and the skills and the training and everything, so that you've got a set of people in place that can just do that. There should be a kind of trigger point, right, where either Parliament votes on something or the Prime Minister presses a kind of button mark panic. And when that is done, you kind of move to, here's the normal process where it's fine to take 12 months over something, or it's fine to take 6 months over something, or whatever it might be. But here's the emergency system where people are authorised to just go, right, we've got to smash this, we've got to execute at scale, we've got to do it all fast. If that means just calling people up and doing handshakes over the phone and we'll get the money to you, take off now, then that's what's got to happen. But we didn't have, that just did not exist, that approach.
The last question.
Yes, my final question is actually about vaccines, just bringing it back to the top. You've mentioned Bill Gates, Mr. Cummings, who has vocally opposed IP waivers, and we know that vaccine production globally is throttled for many reasons, whether it's the control of vaccine supplies by wealthier countries and the hoarding of vaccines. If you were advising the Prime Minister, would you also be supporting President Biden's move to support lifting patent protection, and what is your opinion on vaccine IP?
I don't really have an opinion on it. I strongly suspect that Bill Gates knows far more about this than President Biden does. If Bill Gates is saying that this is a big mistake on vaccine production, then my kind of prior view would be he's almost definitely right, and we should, at the very least, take his opinion extremely seriously.
Thank you very much indeed. Greg Clark.
Thank you very much, Jeremy. On vaccines, you said that it was Sir Patrick Valence's idea to set up the vaccine task force. Is that right?
Certainly Patrick Valence had the idea. I think, like lots of good ideas, there are a few different people thinking about similar kinds of things at the same time. Certainly Patrick, I've got a text from Patrick Valence where he texted me directly on, I think, the 24th of March. I can confirm that if anyone thinks it's relevant, where he says explicitly to me, I want to set up a vaccine task force and do it outside Department of Health, correct? I and some other people were having kind of parallel conversations with others round about the same time. And then essentially Patrick and I both spoke to the Cabinet Secretary about it.
The deal with AstraZeneca, between Oxford, AstraZeneca and the government, that was done before the vaccine task force was set up. Do you recall who was instrumental in bringing that to bear?
My memory of it is that Patrick Vallance was instrumental in it.
Right. So it was. So he was involved in both of those initiatives.
Well, Patrick, before he came into government, had worked in the private sector, working literally on vaccines. So he understood and actually knew a lot of the key players involved. Certainly, my conversations on the AZ vaccine were with Patrick, and there was at one point a terrible fright that Department for Health was about to sign a contract, basically a Duff contract on AZ, which would not have given us the rights to the vaccine, or would have left them questionable. And Patrick kind of intervened and sorted it out and made sure that the contract worked out properly, thank goodness. So I think Patrick deserves absolutely massive, enormous credit for his role in the vaccine task force. There's no doubt about it. I think, as far as I'm aware, he's the first senior official who came up with the idea. The other people who I know talking about it were kind of people outside of government. He was the first official to come up with the idea. He pushed it. He came to me. He came to the cabinet secretary. He made the case to the PM, and I think he deserves enormous credit from the country for his role in it.
Absolutely. So in terms of lessons learned, that's clearly a very strong positive. I think you referred earlier to the idea that actually things may have been done perhaps even quicker, triumph though it was. And I think you were referring to starting human challenge trials earlier. Was that something that was contemplated? And tell us about the history of that suggestion.
So I think, to stress, this is not my idea. So this is not like some idea that I think that I've come up with, which is a good idea. It's not. It's essentially the idea is that normally, obviously, for any kind of vaccine thing, you have a whole testing process, and you've got to take quite a lot of time to go through it all, because you've got to make sure, if you've got a disease that's killing, say, 1 or 2% of the population, then you've got to make sure you don't have a vaccine which kills more than that. However, for something like this, I think from the point of view of overall human civilization, how could we have done better? I think it's unarguable of what should have happened. The companies doing mRNA vaccines basically created the vaccine itself in literally hours in January. Hours. What should have happened is that governments like America and us should have gone to those companies and said, right, we're going to take your idea, we're now going to have what's called human challenge trials. We will pay 5,000, 10,000 people, and we'll pay you to be injected with COVID. And then you have some kind of control system where you're injected with COVID, some of you get this vaccine, some of you don't get this vaccine, and then everyone takes their chances. And then, if you die, your family will get £1 million or whatever, something like that. That would have obviously been the best thing to do. And if we'd done that then, we could have hugely cut the time, I think, for doing this. We could definitely have got vaccines in people's arms by September. And the reason why I think this is an important thing is, imagine if we suddenly have another thing like this, but it's not like COVID, it's something like smallpox or Ebola, which kills 1 in 3 people, right? We have to be able to have a system that doesn't just go, oh well, tens of billions of people are going to die, nothing we can really do, we've got to go through this safety challenge process. We've got to think now, and this is why I'm so aggressive, I suppose is the word, about having this lessons learned thing now. We've got to have a system in place where we go, holy Lord, new Ebola thing, right, mRNA companies, Pfizer, where's the vaccine? Right, 10,000 people, what's the price that it pays?
So this is one of the reasons we're conducting this inquiry, so we can get on with lessons that can be learnt. But just to understand it, was the fact that we didn't do that, and as I say, there's no criticism of the fact that this was done at remarkable pace, were we constrained by regulation or by a kind of distaste for the risk involved in injecting healthy people with COVID?
I think there's definitely regulatory issues that need to be sorted out, but I think, like, fundamentally, like lots of things, a kind of groupthink mentality meant that just in general it was never properly explored. I mean, a few people did suggest it, and it was talked about.
Who suggested it?
But I actually can't remember now who suggested it. I know that there were conversations around about it. I got emails from some people saying you should be doing this. It was one of the many things that I should have pushed harder and tried to force a conversation about and didn't do enough on. But it was just, as far as I'm aware, it was just never really properly discussed. But obviously, should have been.
Just a couple more areas. You've raised concerns that the plan for vaccination, or the adjustment of vaccines to new variants. I think I sensed from some of your recent tweets that you think that's not as sound as you think it should be. Have I got that right?
Yeah, I mean, obviously I'm not in government anymore, but I talked to people who are involved with it, and people have just expressed concern to me that since Kate Bingham left, that the kind of normal entropy process of Whitehall has got its fingers on the thinking and the operations around this, and there hasn't been the kind of very aggressive approach that some inside government want about thinking through the danger of variants and how to make sure that the vaccine task force is ahead of the game on the whole thing. I mean, I can't go into any details because I'm not aware of them, but I've had senior people express this concern to me. Yes.
Is that a personnel or an organisational concern? So what's happening? Is the kind of the forest sort of creeping back into the
clearing? I think it's a combination of both, yes. I think there's been a shift in personnel as far as I understand it, and concerns about the organisational setup.
Right. You've spoken very positively about Kate Bingham's role in this, as well as Sir Patrick and others. She went through a difficult time in the autumn, in which she was being criticised roundly from a lot of quarters, and some of that briefing was alleged to come from Number 10. Were you aware of that at the time? Did you pick up that this was a problem?
I was aware that there was briefing against her. I was told at the time by officials that they thought that most of this had come from DH, but like most of these things, one never really got to the bottom of it. Certainly nobody who you could describe as being part of my core team obviously was involved with that, and I asked all of them, do you know where this is coming from and what's going on? And the closest we got to is essentially people in the system kind of feeling either their noses put out of joint or jealous about her profile or whatnot. Lots of outside. One of the bad things that happened was lots of outsiders who came in to volunteer to help. The same thing happened in terms of test and trace. People who dropped massively lucrative careers to come and help test and trace also got trashed in the press by parts of Whitehall, which I thought was terrible. And Kate, I think, got caught in that sort of crossfire.
So you're not aware of any particular briefing against her from Number 10, but conversely, there was radio silence from Number 10 in terms of defending her. And my understanding is that she had to threaten to go on a broadcast round personally before there was a response from Number 10. Again, were you aware of that?
So, as I said earlier on, I tried to stay very far away from kind of day-to-day media things. I was, I've got a vague recollection of a time when there was some kind of problem in her call. I think she might have called the PM directly or something, and said, essentially, that I'm very unhappy about what's going on, and I want some support from Number 10. But I wasn't part of that conversation, and I don't really know what happened, I'm afraid.
But given the significance of her role and the praise that you've quite rightly lavished on her, did you not feel, observing, even as a reader of the newspapers and the blogs, that, hold on, we should be backing the work that she's doing?
Yeah, I mean, as far as I was concerned, we were. I mean, we obviously supported the work of the vaccine task force.
But in terms of Kate Bingham's role in that?
I mean, Number 10, as far as I was concerned and as far as I was aware, Number 10 was always supportive of the vaccine task force and supportive of Kate Bingham. As I said, I tried to escape. I tried to keep out of the way of lots of conversations with the Prime Minister about briefing and leaks and all that sort of thing. So I'm not the person to speak to you about it. All I basically remember is there was some briefing against her. I asked at a couple of meetings, where do we think this is coming from? The best guess of people in number 10 was parts of Whitehall have had their noses put out of joint. I also vaguely remember some Sunday Times story about her, but I can't remember what that was. But I don't think I can add anything very useful to the discussion.
Finally, just looking back and thinking of the system, when you appeared before the Science and Technology Committee, you talked about the deal that you did with the Prime Minister when you came in to be his advisor in Downing Street. And you said that there were 4 components of it. One was to get Brexit done, the second was to double the science budget, the third was to create a new research agency modelled on DARPA or ARPA, and the fourth was to change the way that Whitehall works. Now, again, you've talked about this a lot in your blog in 2019. You talked about turning government institutions responsible for decisions about billions of lives and trillions of dollars from hopeless to high performance. So this was one of the things you thought about and you brought into Whitehall. Looking back, as we are and as you can now, some of the failures have been organisational and operational. The fact that we had to stop testing in the community because we didn't have enough tests, the fact that we ran out of tests in September. Why did something that was such a priority, in which was part of the deal for you being in Downing Street, why was it not possible to have made good progress on that during the 9 months that you were there, say from July to the spring of 2020?
Well, I mean, July 2019 to the election was essentially just completely dominated by the constitutional crisis over Brexit, and we didn't have the bandwidth or the real authority to start trying to change all sorts of things in terms of Whitehall. We had to be very focused in what it was that we tried to change. So, for example, we did change the whole decision-making structure around the negotiations and around Brexit. We did change radically and effectively. I started work on things like the procurement reform, but it's also the case that the situation was so overwhelming, particularly after the kind of prorogation and the Supreme Court judgment, that in September 2019, I had senior officials come to me and say, the system's creaking and very shortly senior people are just going to stop obeying orders from this Prime Minister and are going to regard it as not a legitimate government. So it was a really, really weird time. That wasn't an environment in which you could suddenly start saying, right, we're going to have all of these huge shifts to the basic wiring of Downing Street. And Whitehall, once we came back in January, I did begin a lot of this process. I talked to the Cabinet Secretary about making various changes to the civil service HR system. As I've said, I started a whole process from the beginning of January in terms of trying to change the procurement system and other parts of it, and the data side. The problem was that we basically only had a kind of 6 weeks from coming back the first week of Jan to COVID sort of completely overtaking everything from kind of mid-February to change things. Now, one of the things that did happen, which was relevant to the September decision, was building the what's known as the Analytical Private Office in Number 10, which I think will be a permanent institution and will become a permanent part of how every subsequent Prime Minister works. I think no one in their right mind would possibly get rid of it, and everybody involved with it knows it's been a great success. So I think that shows, if you read the media, you'd think that this was all some huge row between me and all the officials and everyone hating it and everyone screaming at each other. But the truth is, pretty much all the good senior officials completely supported me on that and helped to help me do it, and it was a joint enterprise. It wasn't Cummings against the system. It was all sensible people realised that this was a huge gap in Whitehall capabilities, and we had to try and change it, both structurally and in terms of the specific skills.
Okay, thank you.
Thank you. James Davis.
Thank you, Chair. Thank you, Mr. Cummings, and I think your 6th hour in front of the committee.
Feels like 1 minutes.
You talked about the success of the vaccine task force. Are there lessons to be learned from that can be applied across government?
Certainly, I think, as I said, some of the core principles of who is actually responsible for the team. Jeremy knows, Greg knows, like, the British state is set up almost by design to create a dysfunctional system, because you have to go out and potentially resign over things that are being done, and you cannot fire a single person apart from your spats in the department. Like, nothing that works well in the real, literally nothing that works well in the real world ever works like that. It's a completely crazy system. So you have a system in which responsibility is by design diffused and no one knows who's really in charge. One of the key things in the vaccine task force was we tried to just keep things very simple and to have it. How do really good things work? You know who the boss is. It's her team. Kate is going to pick the people. Patrick's going to give scientific advice. And if it turns out that Kate Bingham is no good, we'll get rid of her like that and we'll put someone else in who is responsible, etc., etc. That was the whole reason for the approach. She picked the team. She did a good job in picking the team, and everyone knew that they were working for her. They weren't working for Hancock. They weren't working for the Permanent Secretary in DH. They weren't working for the Cabinet Secretary. And that very, very simple principles are the core of the difference between well-run organisations and badly run organisations. Mm-hmm. So I think there's obvious lessons to learn. The problem is that in much of Whitehall, it kind of suits everybody to be in the Spider-Man meme of everyone pointing at each other and saying, well, it's him, no, it's him, no, it's him, no, it's him. And changing that is, even after a disaster on the scale that we've seen, it's going to be a really big job to have the conversations like, well, is the Secretary of State actually in charge of this? Can they really do that? Because the Cabinet Secretary, a lot of people are going to have criticised Mark Sedwell, but Mark Sedwell was perfectly within his rights to say to the Prime Minister, Matt Hancock is the Minister responsible, and he was correct. But we were also correct to say, but so-and-so is in charge of this, and so-and-so is in charge of that, and I can't fire them. Like, fundamentally, the only person who could fire them is the Cabinet Secretary, and the only way that happens is if the Prime Minister tells the Cabinet Secretary to fire them. You know, so the whole thing doesn't work if it's like that.
Okay, so moving on to COVID therapeutics, obviously success in that field, but you have said previously that funding bureaucracy held back progress.
Yeah.
Can you tell us more about that and how those issues were overcome?
In February, March, various scientists and entities came to Patrick Vallance and me and basically just said, you know, that there's a standard kind of scientific funding process. It takes a long time to get through, but we were in this wartime situation. Can you basically bulldoze some of the rules out of the way? Can you speak to UKRI, etc., etc.? We did do, both Patrick and I talked to UKRI and other parts of the system and said, here's what the blocks are, A, B, C, D, can you try and scupper these and basically create like a fast track process. So if people like Paul Nurse call up and say we can do blah, you can just go, right, how much 10 million done, how much 20 million done, etc., etc. And I think that was, it certainly wasn't perfect, but it did change quite dramatically, kind of February to April.
Okay. And the recovery trial has been respected around the world in its success. What do you put their success down to?
I think similar sorts of principles, clear responsibility, some great people in charge. There's a guy called Jeremy Farrar, I think, who played a critical role in it. I mean, part of my job is I basically, I know far more about the things that went wrong, if you know what I mean, the things that went right. Like, if things seemed to be going right and people were saying that's okay, I had so many other things to deal with that I kind of didn't really go into it. So the recovery trials I don't really know very much about, because people just said it seems to be going well. I only got involved with Jeremy Farrell if he called me up and said I've hit the following problem. Otherwise, I just kind of let people get on with it.
Okay. Now, these are UK-wide endeavours. One of the criticisms has been the disjointed approach across the UK with devolved administrations in particular. What do you recall of discussions over using public health legislation with respect to, or in comparison to, civil contingencies legislation?
Again, my memory's pretty hazy, but fundamentally, the Cabinet Secretary said the Civil Contingencies Act is essentially useless. It was drafted back in the 70s. It's had a few tweaks, but it's completely unfit for its job. If we try and rely on lots of its powers, we face the problem that various people who don't like it will go to the courts and will suddenly be bogged down in judicial reviews at a time when we haven't got 3 weeks to go to a court, even on a fast-track process. So that was a big problem, and that's basically why we introduced the kind of emergency coronavirus bill. Again, one of the reasons I think now for why you guys are right to be having this inquiry is that upgrading the whole Civil Contingencies Act is a critical thing. One very simple example of that is the whole question around enforcement. One constant problem that we had all the way through the spring and summer and into the winter was, well, the police say that their powers are unclear, we can't do this, the courts won't uphold that, blah, 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 and the emergency powers are unclear in various ways. And so we kind of found ourselves in this situation of people arguing for greater and greater restrictions on certain law-abiding people because they felt that we couldn't actually enforce certain rules against non-law-abiding people, which was a kind of terrible ratchet to get into. So I think that's another thing. I'm afraid I'm not at all kind of knowledgeable about that side of it, but I do think that's an important question.
Thank you very much.
Thank you. We're going to adjourn now. That concludes the section on the vaccines. We've got one more section to do, which is on the run-up to the November lockdown. And we'll reconvene at 3:05 for that, okay. Just to give people a slightly longer break. So session adjourned, order.
The proceeding is currently suspended.
Almost got caught out there. Hello everyone, that is the end of the
proceeding is currently suspended.
Yes, we heard that. Where's my camera? Okay, so that was the end of the second sitting today. That's the second sitting today. So what we're going to do now is, instead of waiting an inordinate amount of time, we're just going to skip directly to the live feed. Where is it? Here we go. Let's make sure we're at the right time. We'll make sure we're at the right space, and then we will just let it go, because
where we're going to consider,
instead of waiting for an inordinate amount of time, let's just get right back into it. So here we go. We are now on to part 3. I will stop waffling because I'm aware I'm not making a whole lot of sense.
And the winter
Enjoy.
Around lockdowns. Perhaps I can start by just asking Mr. Cummings just to give us a brief summary of what were the key decisions taken during the autumn.
Well, I guess the most significant were that mid-September, Sage and Patrick Valence advised that we take rapid action and do some
Sorry, a break in there very quickly. Before Dom goes, sorry, 1 second, I'll pause that a second. Yeah, before, why, my mic sounds loud today. What is happening with this? It certainly makes a change where everything's sounding too quiet. That is for sure. So yeah, I'm not sure if there was a slight audio issue with part 2, but I believe that has been sorted. I just wanted to say that before we go any further. Enjoy part 3. If you've not subscribed yet, press subscribe, it's down there. Remember, get into the comments, and yeah, let's enjoy another few hours of Dominic Cummings burying the crap out of Matt Hancock. This should be entertaining.
Of where the numbers were going. Prime Minister decided not to do that. We then went round the houses on that decision, and then ended up doing it on the 31st of October. In the meantime, the government kind of careered around all over the shop trying to do these local lockdowns and other things, but in the end, it didn't work. I mean, is it useful if I kind of spell out what the actual meetings were when, so that you can?
I think that would be helpful, so, and then Jeremy Hunt is going to.
Essentially, what happened is, in the week of the around about the 15th of September, I think, is it the 18th? This is the Friday. I think so. Essentially, so Patrick Vallance and Chris Whitty came to Number 10, and they said, we and Sage think that we need to consider a kind of 2-week or possibly longer lockdown. Bear in mind that back in the summer, when we were discussing the whole kind of reopening plan, I asked Chris Whitty, what do you think the chances are that we'll have R over 1 again by September and back to problems? He said, I think that if before the schools go back, probably R will be below 1, but it's over 50% likely that R will be over 1 if you bring the schools back in September. Many of us had said in the summer to the Prime Minister, do not tell everyone, get back to work. Don't do this whole everyone go back to work thing and COVID's over and whatnot. But at that point, his main concern was about the economy. So over July, August, obviously, the whole impetus of the government was to try and pretend that we could get back to normal. So 17th, Patrick and Chris come to Number 10 and say we should lock down. I say to the Prime Minister, quote, the lesson of the first wave was earlier the better when dealing with exponentials like this, unquote. Then on the Friday, there was a long discussion of it with the PM, and essentially at the end of that, he decided we're not going to do anything. So I said, listen, we all lived through the March horror, and I've got a dreadful feeling about this, that we're making the same mistake. I said, before you make a final decision on this, I want to do something that sounds a bit weird. I want to have another meeting on Monday where what we do is we imagine the meeting is the end of October, and we'll have all the documents presented to you. So I'm talking about kind of Monday the 21st, I think it is. So the meeting itself will be on Monday the 21st of September, but we will set the whole thing in the future at the end of October. And we will look at the data with what is our best guess that this is what the situation is going to be like at the end of October, and talk through all of that. Because if you're going to look at that then, and then decide to lock down, we should do it now. That's the whole lesson of March. The Cabinet Secretary says, I completely agree, that's a very good idea, we'll get the data team on it, etc., etc. So the data team, which in February, March didn't really exist, it was Ben Warner. By now, there was a really, really good team of a sort of mix of officials and SPADs in Number 10. They crunched all of these numbers with Sage data and other stuff over that weekend. Then on the Sunday evening, there was a meeting with a combination of Sage scientists and some external people. By this point, unfortunately, the Prime Minister was listening to various people who were saying things like, there's already herd immunity in the population, there won't be any second wave, etc., etc. So we had this meeting in the Cabinet Room Sunday evening. Patrick and Chris gave their view. A guy called Hennigan and a woman from Oxford called Professor Gupta, I think it was, gave the kind of don't lock down view. John Edmonds said, who was on stage, surely we're going to learn the lessons of March. Here's what the data is going to be. You are not going to. The only logic of not doing a lockdown then will be that you're not going to do it at all. There's no way that you're going to make that decision. Just do it now, otherwise it's all going to be worse. Prime Minister said, I'm not persuaded of that. We then had the meeting where the kind of hypothetical meeting in the future, and there was a brilliant young woman called Catherine Cutts, who we brought in from outside Whitehall, who kind of presented all of this data. So we set it all out to the Prime Minister. Here's the stuff. So remember, there's a huge contrast at this point to what I was describing in March. In March, no testing data, no proper data system, me scribbling things on a whiteboard with an iPhone. By now, you've got a completely professional team really on it. They've got all the testing data, they've got all the NHS data, it's all really clear. They set it all out. And it's just, from some of our point of view, just completely obvious that in this hypothetical point, 5-6 weeks hence, when we're looking at that, we are now days from the point at which you've got no further, you're going to have to act now, or you've crossed the tripwire whereby the NHS is going to get smashed again. That's what all the data is showing us. And the Prime Minister wasn't persuaded about this. I said to him, the whole lesson of what happened before is that by delaying, the lockdown came later, it had to be more severe, it had to last longer. The economic disruption is even worse anyway, and will have killed God knows how many thousand people in the meantime who've caught COVID, who wouldn't have caught it if we act now. Surely we've got to learn the lessons from the past. And Prime Minister decided no and said, basically, just going to hit and hope.
Let's pause at that point and we'll go into some detail. I'm going to start with Carol Monaghan before I go to Jeremy Hunt. Carol.
Thank you, Chair. Mr Cummings, you'd said earlier in your evidence today that you should have been hitting the panic button back in February, March time. So we're now talking September, we've learned lots of lessons. As you say, we've got a handle on things.
Yeah.
Were you hitting the panic button in September?
Yes.
And was the Prime Minister aware of how seriously you were taking things at that point?
Yes, at that point there was no. So as I explained before, in February, March, I was very frightened, is the only way to describe it, about hitting the panic button, because I was worried, what if I'm wrong and the people telling me that the official plan is wrong are wrong, and the data was completely hopeless, etc. By this time, it was a completely different situation. Basically, all credible, serious people, in my opinion, were saying essentially the same thing. So I was very, very clear with him about it.
And so you were pressing for a circuit breaker lockdown
Yes.
in September. So if the Prime Minister wasn't persuaded, in your words, of the importance of this, whose advice was he taking?
He wasn't taking any advice, he was just making his own decision that he was going to ignore the advice.
So did his Cabinet agree with his decisions?
Cabinet wasn't involved or asked.
Did you hear anything from Cabinet members about these decisions?
There were sort of different views. I've been very critical of Matt Hancock, but I think Hancock agreed with me actually in September about acting then.
Okay, and
but there wasn't any formal Cabinet meeting to discuss it, or if it was a purely Potemkin exercise. It wasn't a kind of real discussion that actually affected
so all of these decisions were entirely the Prime Minister's?
On the September lockdown, correct.
Now, I understand the meeting with SAGE representative and the Chancellor and the Prime Minister back in September, where they were told of the importance of that lockdown.
Yes, I was there, yeah.
You were there as well.
Mm-hmm.
Okay. What was the Chancellor's view on this?
The Chancellor's view was the Department for Health, who want to do this, have no plan. There is no plan for what to do. Like we've just gone through a whole thing where we had all of these arguments in June, July, and some people, like Dom said, get back to work, don't just try and go hell for leather for the economy, but you decided to do it. And now the Department of Health is suddenly hitting the panic button again and saying, well, we've got to stop for 2 weeks. And then what? Then are we going to tell everyone to go back to work again? And then what? Then 2 weeks later to say the opposite? Like, there is no plan. There is no coherence to anything.
So knowing that the Department for Health was chaotic in its approach here, was the economic arguments, were they outweighing everything else at this point?
For the Prime Minister, yes.
And there was talk, and certainly the Scottish Government were pushing hard following that SAGE advice for an extension of the furlough scheme. Why was that not discussed more seriously at that point? Because it was only eventually extended at the very last minute.
I can't remember all the kind of time details on timing with that, I'm afraid, but I know all the way along, Rishi and his team took the whole issue about 30. Remember, they came up with the idea. It wasn't us in number 10. They came up with the idea to do it, and once the Prime Minister said at each stage, I'm going to do X and I've made a decision, the Chancellor always extremely competently and extremely ably and effectively kind of rode in and said, right, here's the economic package to go along with it, and he made it happen.
Do you think if a different Prime Minister had been in number 10, things would have been managed in a different way?
Undoubtedly, yes.
So his predecessors?
You mean, what do I think each of his predecessors would have done in that situation?
If it had been David Cameron and Theresa May.
I mean, it's all a bit hypothetical. God only knows what each of them would do. But I would say, if you took anybody at random from the kind of top 1% competent people in this country and presented them with the situation, they would have behaved differently to how the Prime Minister behaved.
So, if we're describing his behaviour at that point, was it driven by arrogance, complacency, or was it something more sinister?
No, he just didn't. I think there's a great misunderstanding people have that because it nearly killed him, therefore he must have taken it seriously. But in fact, after the first lockdown, his view was he was cross with me and for others into what he regarded as basically pushing him into the first lockdown. His argument after that happened was, literally, quote, I should have been the mayor of Jaws and kept the beaches open. That's what he said on many, many occasions. So he didn't think in July or September, thank goodness we were pushed, thank goodness we did the first lockdown, it was obviously the right thing to do, etc., etc. His argument then was, we shouldn't have done the first lockdown, and I'm not going to make the same mistake again.
So that does sound like arrogance.
I don't know if arrogance is the right thing. It's just he as I said in the earlier session, the Prime Minister took the view in January, February that economic harm caused by action against COVID was going to be more damaging to the country than COVID. And we could not persuade him that if you basically took the view of let it rip and not worry about COVID, you would get not just all the health disasters, but you would also then get a huge economic disaster, because if people are faced with not having any health system, which is what they were faced with in March if we'd gone down Plan A, or what we would have been faced with if we hadn't finally put the brakes on in October, then people are going to lock themselves down out of terror. And we can never persuade him of this argument. He also essentially thought that he'd been gamed on the numbers in the first lockdown. And he thought the NHS would somehow have got through all the stuff about the NHS.
Was he not concerned about the number of people that died? I mean, did you hear him say, let the bodies pile high in their thousands, or it's only killing 80-year-olds?
There's been a few different versions of this of these stories knocking around. There was a version of it in the Sunday Times, which was not accurate, but the version that the BBC reported was accurate.
And you heard that?
I heard that in the Prime Minister's study.
Okay, and next question.
That was not then, that was not in September though. That was immediately after he finally made the decision to do the lockdown on the 31st of October.
Okay, next question. You showed us a whiteboard picture, and one of the phrases on it that I think has caused some concern is, who do we not save? What was the answer to that?
Well, that was asking the obvious question at that point. You know, at that point it was too late to stop disaster on the 13th of March, was my view, and the people who I thought, you know, had figured this out best view. So the comment on that comment on there was essentially like, we're already partly over the cliff. Like, who is not going to be saved in this situation? Like, have we figured that out? Who's going to be, who's most vulnerable, etc., etc., etc.
What was the final straw that has prompted you to come and give evidence such as you are today? Because some would say for a government or Prime Minister advisor that discretion is important, but you've disclosed everything today. So what has prompted that?
I think that I think a couple of things. I think the scale of the disaster is so big that people can't wait to, like, people need to understand how the government failed them when they needed it. People need to understand that now. Who knows what other kind of problems might come along in the next few years that could easily have exactly the same consequences, because, you know, critical as I've been of the Prime Minister, in no way, shape or form can you say this is just his fault. If you just shuffled him around, or a couple of ministers, or Hancock, everything would suddenly work. It wouldn't. These failings are programmed by the wiring of the system. And if you have something this bad, and you've got tens and tens of thousands of people died who didn't need to die, and massive economic destruction, the way that we've had it, that didn't need to happen, if we'd sorted things out earlier, everyone in this country needs to face the reality of this. And secondly, it's become clear over the last couple of months that, contrary to when I spoke to the Prime Minister about it last year, in the summer, he has clearly changed his mind and is now desperate not to face up to this and not to learn the lessons. I think because of the disaster in the autumn.
So, talking about not learning the lessons, can I ask you just some quick yes-no answers, and then I'll be done, Chair. So I appreciate that you did leave in November, but were you surprised by the government delays in putting India on the red list?
No, not surprised at all. It's completely in character with number 10.
And are you surprised by the confusion on the current travel arrangements with green, amber and red countries?
I'm afraid it's déjà vu all over again.
Who is now advising the Prime Minister?
Don't know.
And are you surprised that people are being encouraged to travel this year?
I'm not on top of it enough to have a kind of a sensible view, I'm afraid, in terms of whether or not people should be travelling. I haven't followed
and
it or
last year?
People. Well, I think lots of things that we did last summer, as I said, I think were, I said at the time, I thought were big mistakes. Lots of people said to the Prime Minister last year, do not listen to the media or screaming at you about get back to work, physically go back to work, because as soon as you get to September, you're going to be screaming back at everyone again, work from home again, and everyone's going to think that you've lost the plot and the government's lost the plot, and they'll be right. But that was one of the many arguments that I lost on this whole thing.
Thank you very much, Mr. Cummings. Thank you, Chair.
Thank you, Carol. I can't remember whether you said, were you opposed to Eat Out to Help Out?
I was opposed to the general strategy that the Prime Minister set out. I think once the Prime Minister said, everyone get back to work, everyone get the economy going and everything else, then things like that are logical. The problem is his fundamental decision about the strategy was wrong.
But in the particular, did you advise against it? Did you advise anyone against it?
I can't really remember conversations, to be honest, about Eat Out to Help Out specifically.
It's quite a big initiative, wasn't it?
To be honest, in the grand scheme of things, it didn't seem like that at the time, no.
So you don't recall having any conversation?
Oh, no, I was definitely in meetings in which it was discussed, but at that point I basically lost the argument on the approach.
So because the strategy was not the one you wanted, you didn't raise any objection to actions that were consistent with the strategy?
Specifically on Eat Out to Help Out, I don't remember, to be honest, exactly what the conversations were that I had on it. Before that happened, that was a consequence of a strategic decision made by the Prime Minister, which was, we've killed the economy, we've got to get the economy back, COVID's in the past, there won't be a second wave, get everything open.
Sure.
Me, the Director of Communications, the Cabinet Secretary, other people said, hang on a second, what about all the following objections to this plan? We lost that argument, the Prime Minister made a decision. Once that happens, then lots of other things naturally flow, like, for example, students coming back in September, and, and all that sort of thing, which clearly, if you're taking a different view of it, you would never have done. Okay, so you didn't oppose the Eat Out to Help Out because it was consistent with the strategy? I wouldn't say that. I honestly can't even remember what I said about Eat Out to Help Out. I didn't pay huge attention to Eat Out to Help Out. Okay, Jeremy Hunt.
Thank you. Now, you've been very clear that the Prime Minister rejected the idea of circuit breaker towards the end of September. Of course, what he would say is that they did have that circuit breaker in Wales, but they still had to go into the November lockdown. So many people say that it was actually inevitable anyway. The seeds had already been sown by that stage. I just want to go through some of the things that could also have contributed to the need for a second lockdown. Now, you don't recall opposing Eat Out to Help Out, which is something that a lot of people have talked about. I think you just said then, but just correct me if I'm wrong, you didn't oppose students going back to university at the beginning of September, is that right?
Yes, I advised against that.
You did advise against that?
Yes.
You did, okay. What about...
I didn't say that I was opposed or pro Eat Out to Help Out. I just thought it was part of a plan which on a grander scheme was wrong. And I don't remember if I even gave a view specifically on Eat Out to Help Out.
But you did, for example, advise against telling people to go back to work.
Yes.
You thought that was wrong.
Yes.
But it's just that, and you did advise against students going back in September.
Yes.
You did. And not sure about Eat Out to Help Out. Can I ask you about the high numbers of infections that were circulating on NHS hospital wards? So NHS data now says that about 8,700 people died having picked up infections inside hospitals, and we were obviously very sorry to hear about your uncle earlier on. Did you advise that we needed to bring forward the weekly testing of NHS staff, which wasn't actually introduced until November?
Yes.
And
there were many meetings on testing of NHS staff. One of the things that I spent a huge amount of time on was trying to get these LAMP and lateral flow tests going, so that NHS staff could basically have like a test a day for everybody in the NHS if they wanted to. It was clear that was technically possible, it was organisationally possible, and it should be done. And I did all I could to try and accelerate that.
And who resisted that happening? Because it took a long time. I mean, we did care homes in July. That was actually, I think it didn't actually get operational until September, but it was promised in July. But it wasn't even promised for the NHS until November.
I think just in general on LAMP and lateral flow, there was just this same kind of incredibly conservative attitude and a kind of, well, if we just do PCR, everyone knows where they are and no one's going to criticise us. As soon as you do something new inside the civil service, if it works, no one gets any credit, and if it doesn't work, you get the blame. So there's this huge kind of reverse ratchet all the time against this. It took huge effort from Number 10 to try and push this through, and that's after we had the Prime Minister supportive, the Cabinet Secretary supportive, the Hancock and personally supportive, and we had a whole bunch of great people involved. I mean, to give you an example of how hard this was, after I spoke myself to some of the scientists involved with getting the mass testing going, and they described all of the problems, and I spoke to the team in the test and trace, I sat down in the Cabinet room with the Cabinet Secretary and the head of commercial and the head of HR for the civil service and another whole bunch of literally the top officials. And the Cabinet Secretary and I said to all of them, this is a war. This is a wartime measure. This could make all the difference between how this country survives, hundreds of billions of pounds between now and the vaccines hopefully coming on stream in Q1 next year. Any rules, forget. Procurement things, throw them away. HR rules in particular, throw them away, because there was huge problems with recruiting the team. So you can't really have much more than the PM's main advisor and the Cabinet Secretary all saying that. 2 weeks later, all the people just came back to us and said nothing's changed. We had to do the whole thing again, and the Cabinet Secretary had to threaten people with being fired. So there was a whole huge just general resistance to this thing because it seemed so new and risky. And you've got these PCR tests where the accuracy rate is very, very high, and then a lot of people couldn't get their head around the stats of the mass tests.
But the thing that's puzzling about weekly testing of NHS staff is that there were repeated calls in this place from lots and lots of different people to get on with it from the start of the summer on.
Yep.
And it wasn't even announced as a plan until November. So it wasn't like anyone said, we want to do weekly testing of NHS staff. It was actually not announced until November, and then the promise was to try and get it done by, I think, the first week of December. And so why did it take so long even to accept that that should be the plan, given that we now know so many people picked up infections in hospitals?
With respect, that I don't think that's... So I'm not arguing with you about the announcement. I can't remember now when definite announcements were made. But I was having meetings in April about testing NHS staff on as fast a basis as possible. I had meetings in July about getting the mass tests out. And I had literally meetings almost every day of my government career from the 1st of September till the day I left on mass testing and this subject. So
you wanted to do it, that's the point. It just wasn't announced as an objective. That's
Number 10 was pushing it, the team in the test and trace team that we built was pushing for it. That was definitely one of our core goals, yes.
Okay. And then just last one from me on this section. You said earlier that you should have resigned probably in the spring and definitely in September. You did actually end up resigning at the end of the year. Can you understand how to some people it looks like you resigned after losing a power struggle in number 10, but you didn't resign over issues that cost thousands of lives, and how that makes people angry?
Well, I mean, there's so many crazy stories about what happened in number 10 that are mostly untrue. So what I'd say to people is don't believe what you read in the newspapers about things like that. I think that...
so your resignation had nothing to do with Lee Kay not being appointed to the position you wanted, things like that?
So my resignation was definitely connected to the fact that the Prime Minister's girlfriend was trying to change a whole bunch of different appointments in number 10 and appoint her friends to particular jobs. In particular, she was trying to overturn the outcome of an official process about hiring a particular job in a way which was not only completely unethical but was also clearly illegal. I thought the whole process about how the Prime Minister was behaving at that point was appalling, and all of that was definitely part of why I went. However, this had all been, as I said to you, I had this conversation with him the night before my operation back in July. It was clear in July that our relations were very far from where they had been, and they took another terrible dive after the second lockdown in October, because the Prime Minister knew that I blamed him for the whole situation, and I did. And by the 31st of October, our relations were essentially already finished. The fact that his girlfriend also wanted rid of me was, relevant, but not the heart of the problem. The heart of the problem was, fundamentally, I regarded him as unfit for the job, and I was trying to create a structure around him to try and stop what I thought were extremely bad decisions and push other things through against his wishes. and he had the view that he was Prime Minister and I should just be doing as he wanted me to, and that's obviously not sustainable for very long. And I only stayed because I was desperate to try and push through action to stop as many people dying as I could do. Once the second lockdown had happened, it was on the 31st, then it was obvious that I was going to be gone within days. And remember, I'd already said that I was going to go by the Friday the 18th of December in July, so it was not really anything. The thing that I got wrong, and the thing that I terribly regret now, is on the Tuesday the 22nd, after we'd done that theoretical meeting, set in the future 5-6 weeks, which I'd organised, and he saw all the data and he said that. At that point, I was already going in kind of 12 weeks anyway. What I ought to have done is said to him then, I'm resigning in 48 hours. We can do this one way or we can do this the other way. If you announce that you're going to have a lockdown and take serious action now, I will leave, go quietly, we're all friends. If you don't, I'll call a press conference and say, the Prime Minister's making a terrible decision that's going to kill thousands of people. And I should have gambled on holding a gun to his head, essentially. And who knows if that would have worked or not, but fundamentally, it was kind of all upside, given that my role there was basically done at that point. So I apologise for not trying that. I should have done. I was dissuaded from it because people basically thought, well, maybe you can help reverse this decision over coming weeks. It's a constant problem. You stay because you think maybe you can change things. But in retrospect now, seeing how things played out, it's lots of things are quite difficult to figure out hypothetically, but there's no doubt in my mind now that I made a mistake and that I should have gambled in that week.
Thank you, Jeremy. Paul Brister.
Thank you, Chair. Mr. Cummings, I've listened carefully to your advice or your testimony around decision making in September. But Sage's advice on the 21st of September had a short list of options, only one of which was a circuit breaker lockdown. Is it any wonder that the Prime Minister sought alternatives to lockdown, given the weakness of that advice?
Well, I think you can't really take the thing from, as we can see from March, often what's written down in Sage papers is not really very close to the conversations that are in the room. So with respect, I would say that your picture of what was presented to the Prime Minister is not accurate. Patrick Vallance was very, very clear. Chris Whitty was very clear. The data was extremely clear that unless you act, thousands of people are going to die.
So, sorry, Mr. Cummings, it says here in its September advice, Sage said a more effective response now may reduce the length of time for which some measures are required. May isn't will, is it?
The word may does not mean the same as the word will, no, but that's not what the conversation was in number 10.
Okay, all right. In your testimony and on social media, you talk about enabled few, many of whom, to quote you, are now gone or leaving or planning to leave, and the rest who are all disastrously wrong or useless and get the promotions. There doesn't seem to be any in between. Your world only really sees heroes and villains. Is it really that black and white?
No, of course not. But it is a basic problem inside the system that lots of very able people get weeded out from top jobs, and that lots of people who are not fit for them get promoted. That's a core problem in political parties and in the civil service.
Well, do you accept that there are some people who may be brilliant, but who are also difficult and flawed, and in the end are impossible to satisfy?
I didn't hear that very well.
So
there are some people who...
do you accept that some people who may be brilliant, but are also difficult and flawed, and in the end are impossible to satisfy?
Of course, but I mean, but if you're trying to get a team at the top of government to deal with crises, you have to try and get the best talent that this country has to offer, and you're going to and different kinds of talent. You need people who can think through very hard problems in a quantitative way. You need people who can make decisions effectively, and you need people who can build things operationally at scale. And you need teams that can kind of bring these skills together and integrate them. and we didn't have that. I'm not suggesting, by the way, just so that we're completely clear, I am not putting myself in the category of good people who should be promoted at all. Quite the opposite. I regarded my own position there as like a weird quirk of history, and my goal in January was to try and recruit a whole bunch of people who were much smarter than me and much better able than me to deal with government problems, so that I could make myself redundant, which I said publicly, which I believed.
Okay, just one final question. I just want to return to your earlier comment about not being focused on coronavirus until a relatively late stage. One journalist has posted a message from someone who was working in Number 10 at the time, and with apologies for the language, it reads, "Disingenuous little fucker. The reason he wasn't paying attention is that his plan to derail Boris by pulling off his putsch."
Okay, Paul, I don't want any repetition of that language. You can edit it.
Okay. So the reason he wasn't paying attention is that his plan to derail Boris by pulling off his putsch and having Cummings acolytes in every post with power was undone by the reality of the situation. I've never seen such a squirming nest of vicious contradiction embodied in a single individual. What's your response to that?
I don't quite understand the accusation, I'm afraid. What is it about February that supposedly I did?
Well, I guess it's saying that you're distracted by, you say your focus wasn't on COVID until the back end of February, despite the fact that the WHO had already determined that this was an emergency, and you were distracted with other things. The accusation is that you were distracted by placing your own acolytes in every post with power, and that was undone by the reality of the situation. Quite frankly, Mr. Cummings, you have to work with other people, and I guess that's the accusation, that you didn't work well with others.
Well, I think I worked well with some people. I didn't necessarily work well with others. Different people have different kinds of temperaments. I think I would stress that lots of the things that you read in the media about me are not correct. I would point out that on quite a few occasions I've built teams that have been successful because I know how to build teams and I know how to manage them well. The media stories about all kinds of things and about how relations were with civil servants and whatnot are 99% nonsense, and I would advise that you don't listen to them.
Okay, we'll go to Taiwo Awatemi.
Thank you, Chair. Thank you, Mr. Cummings. Mr. Cummings, do you agree? Do you have any reasons to believe that the Prime Minister may have been distracted from leading the national response to the COVID pandemic because of its own personal financial interest?
I don't know exactly what you mean. It's certainly the case that in February he had a string. Obviously, I mean, as a matter of public record, he was distracted by. He was finalising his divorce. His girlfriend wanted to announce being pregnant, an engagement, and his finances and all of that sort of stuff. I mean, certainly in February he had a very difficult time mid-February in his private life, for sure.
So what I'm trying to get at is, given the fact that the Prime Minister is currently writing a book, the fact that he has reportedly spent time seeking private donations to fund his own lifestyle, do you think that that is a useful way for a Prime Minister to spend his time, given the fact that we were in a public health crisis?
Well, obviously, I think that the Prime Minister's focus should be on the Prime Minister's job. I made clear before this meeting my views on what he was doing regarding other things in Number 10, but I don't think today's the day to go into that sort of stuff.
Yeah, fair enough. Just moving on to communications. Do you think that senior medical officers such as Professor Chris Whitty, Sir Patrick Vallant, working within the government were ever used during the evening press conference as political props to present greater plausibility to the government's COVID-19 messaging, even when the message wasn't clear or ineffective?
I certainly believe that the Secretary of State, Matt Hancock, used Patrick Vallance and Chris Whitty as shields for himself, yes. And he used the whole "we're following the science" as a way so that he could always say, well, if things go wrong, we'll blame the scientists and it's not my fault. I think that was, I saw him discuss that with the Prime Minister, and I think it was one of the many appalling things that Hancock did.
And do you think that that was an acceptable way to use the time of senior medical officers, given the fact that we were in a public health crisis?
I think it was certainly a reasonable use of their time. Well, in principle, I think it was certainly a reasonable use of their time to give press conferences. I think that it was actually a good idea for us to do the press conferences in Number 10 with the Prime Minister and the the Prime Minister and the Chief Scientific Advisor and the Chief Medical Officer. I think in principle that was the right thing to do. I was very strongly actually in favour of having the scientists and the medics just explain the reality about what was happening. I think what was not right was the Secretary of State trying to use them essentially as a kind of shield for himself. I think that was unethical and just obviously wrong.
Just moving on to the matter of ethics, as MPs, you know that all MPs have to sign a code of conduct to say that they're going to be honest, that we are going to be transparent, and we're going to be accountable. So do you think that the Prime Minister and other cabinet members, I know you've already expressed your concerns about Matt Hancock, do you think that they were always transparent, honest and accountable to the members of the public regarding the COVID-19 pandemic?
I think inevitably it's a mixed bag. I think that the Chancellor and the Foreign Secretary Dominic Raab did brilliantly. I think Dominic Raab has not got nearly enough credit that he should have done, because he had to step into an extraordinarily difficult situation with the Prime Minister on his deathbed. Now, remember that when Raab took over, there was a conversation in Number 10 with the Cabinet Secretary and Lee Kane, Director of Communications, about calling a cabinet to try and find a replacement for the Prime Minister in case he died. I mean, that's how serious the situation was. And Dominic had to just step into that environment in a completely kind of unparalleled. Nobody had dealt with the situation that Dominic Raab faced literally since Churchill in World War II, because you had the crucial elements of the state gone, Prime Minister on his deathbed, crucial people, the Cabinet Secretary ill, blah, blah, blah. So Dominic Raab did an outstanding job. The Chancellor did an outstanding job. I think I've made my views on the Prime Minister and the Secretary of State clear.
So do you think the reason why the Prime Minister didn't sack the Secretary of State was because in doing so he himself has made very similar mistakes during this pandemic? So in doing so and sacking the Secretary of State would mean that he would have brought his role into disrepute. Do you think that's the reason why the Prime Minister didn't make such a decision? It's
definitely the case that the Prime Minister was told that, contrary to my view, I said sack him. I said sack him almost every week, sometimes almost every day. He was told, though, that you should not sack him. You should keep him there because he's the person you fire when the inquiry comes along. I thought, my counter-argument to that was, if you leave him there, we're going to have another set of disasters in the autumn. And that's the critical thing. Forget the inquiry. The inquiry, God knows when that'll bloody happen. We've got to get rid of this guy now, because every single week things are going disastrously wrong. Like, just the whole focus of how to deal with the politics of the inquiry is mental.
So let's just move on to autumn and how the tiering system was introduced. I know you said earlier that the tiering system.
Sorry, I didn't hear that. I didn't hear what you said there. How the what was it?
Can you hear me?
Yeah, I didn't hear that.
The tiering system was introduced, and you said that was when the government started putting.
Yeah, the division bell's ringing here, so it's a bit.
Sorry, the division bell's ringing. The something system is all we heard.
The tiering system.
Oh, tiering.
And how tiering was the beginning of ensuring that there were breaks in place. Did you? How did we get to a point of the tiering system? How was it decided?
Goodness, I mean.
Were you involved in deciding the tiering system, and did you agree when it was proposed?
I was certainly involved with it. In principle, it made sense to have some kind of regional system. If you look at the experience of East Asia, if you have an outbreak in parts of Korea, they don't shut the whole of Korea down, right? They have targeted specific local action to try and hit hotspots. And what I wanted to do was try and get us as close as possible to that kind of a system. Similarly in Britain, in an ideal world, if you have an outbreak in Cornwall, we didn't want to have to be shutting down the north of Scotland, right? You wanted to be able to kind of have a more nuanced approach. In March, we didn't have any testing, we didn't have any proper information, we didn't know anything, so we were completely snookered, and we just had to do a national lockdown. But the whole point of the shift to Plan B, building testing, etc., was we can then move to the East Asian approach, where then you can have the testing data gives you testing, sewage data, all of that can come together, so you can go fast, hotspot, Cornwall, shut down there, that town, that area, whatever. But Scotland, carry on. That was the conceptual idea that we had for how to do it. Now, in practice, the way that it was actually worked out and the way that it was actually implemented was, full of holes and extremely problematic, to say the least, in practice. But I think the basic concept has to be right.
Okay, and what were the holes? Do you think the government acted quick enough to implement the restrictions? And what were the holes in the tiering system? Restrictions
in September.
What were the holes? You talked about having holes in the tiering system and the restriction. What were they?
Oh well, I mean, it was just it was put together chaotically, and there were all sorts of problems. Are we doing it by town? Are we doing it by region? If you draw a line there, then will you just get people driving 30 miles to go to a pub across the line? Like lots of things, it was the victim of having to be kind of cobbled together when under time pressure to do things rather than having been thought out earlier on. And also, there's kind of sort of second order and kind of reverberation effects of, because we couldn't get enforcement sorted out properly in various ways, then we couldn't do the kind of very specific hyper-local approach that places like Korea did. Therefore, you have to do them bigger. Therefore, you annoy more people. Therefore, more people drive out of the area, etc., etc. So, the whole thing, we just didn't get into the. We basically created it ad hoc because the Prime Minister wouldn't do the kind of let's try and smash it now and get. What should have happened is, what really should have happened is we should never let it get out of control anyway. Once you let it get out of control, then in September we should have smashed it and got control, and then had a career-type, targeted, specific approach.
I think we need to move on. Is that okay, Tara?
Can I just quickly one last question? So my last question was about, earlier you spoke about the fact that when the furlough system was introduced, that there was no plans with that. So as areas were entering into a new tiering system, was there any financial plan properly drawn up and actual modelling done to think about how areas like that would be funded? Because obviously there was issues around some of the financial support, for example, that was provided to Manchester, where the government was given £8 per person to help support that region. So in preparing for the tiering system, were there thoughts about how this would affect individuals, business and the regions in which we're going under lockdown?
So, in a nutshell, I would say that the Treasury did its best in a very, very difficult situation. But the Treasury had to deal with the fact that Number 10's policy was constantly shifting on the tiering and where the boundaries were, and Prime Minister's conversations with specific people. So the whole thing was just sort of so fast moving and chaotic that there was never any time. There was never. In a nutshell, no, there was not a kind of here it is, we've got an exact plan, we know how we're going to deal with all of these different local areas. That hadn't been worked out in the summer, and therefore it was all kind of bodged together in the autumn in an environment where the policy was having to be created, the implementation was having to be bodged together, and the Prime Minister was constantly changing his mind about this area or that area, or harder here or less hard there. So the Treasury were kind of constantly playing catch up on it all.
Okay, I think we need to move on. Taiwo, is it a very brief clarification question?
Does that mean that areas that essentially numbers were just decided just out of somebody's own person, just randomly in someone's head, and when it came to the
there was definitely a lot of crazy randomness in terms of how money was apportioned, and decisions that didn't really make sense. Correct.
Okay, thanks. We're going to go finally to Taiwo, to Chris Clarkson, then Sarah Owen.
Thank you, Chair, and thank you, Mr. Cummings, for your forbearance as we go to the back end of hour number 7. You've already indicated that you think the government was slow off the mark after the advice was given in September that we needed to consider a second national lockdown. Turning to my own constituency, Haywood and Middleton, along with the rest of Greater Manchester, was placed into Tier 2 restrictions on the 14th of October, and then on the 23rd of October moved into Tier 3 restrictions. Do you think the government was acting quick enough to raise tiering and restrictions in areas where there was an obvious increase in cases? If not, why not? And why did you advocate for this tiering system?
Hello everyone, I'm just going to pause there very quickly just to say you are watching Broke Britannia channel on YouTube, or you are watching the Broke Britannia channel on YouTube. I am really crap at this continuity thing, I will admit that. Yeah, I just wanted to say hello. If you've not subscribed yet, hit subscribe. If you want to watch today's PMQs and part 1 of this monumental session of questions and answers by Dominic Cummings, just check out the channel. We streamed the whole thing all day today. I will put you back to the action. When I say action, I mean people talking.
Well, I think the simple answer is, take the second question first. As I explained earlier on, the whole point was to try and shift from a world in which you've got no real data and no real understanding in March, and no real testing, and therefore you're forced to have national measures for everything, to a world in which you've got good testing, you've got good data, and you can be hyper-targeted the way that they are in successful East Asian countries. That was the conceptual approach that we were trying to take. I think that was definitely the right approach to take. After all, that is the way in which the countries that have been most successful on the face of the planet have done it. So I think the kind of direction was correct. It was just that, like lots of things, the thinking was done too late, and operationally it was not done well.
I would agree with some operational inconsistencies. For example, in Liverpool, when they went into Tier 3, personal care facilities like gyms stayed open. In Greater Manchester, they were closed. Who built that into the model?
I don't know, I'm afraid.
Okay. And very quickly, I mean, it sounds like you gave quite a lot of advice during this entire process, and according to you, most of it was disregarded. Why did you stay on? If you had the opportunity to be a whistleblower rather than a whistleblower without a whistle, why didn't you step out of government earlier and call out what you saw as these egregious breaches?
Well, as I said, I thought about it a few times. I discussed it with senior people. I discussed it with the Cabinet Secretary and others. These decisions can be often difficult, and I'd watched the March situation, and then I'd watched how he decided that basically he wished that he'd never done lockdown, he should have been bounced into it, and blah, blah, blah. And I thought, I was extremely tempted to go in the summer, but various people said to me, the autumn is going to be a disaster, he's in complete let-it-rip mode, just open everything up, keep the beaches open. You've got to stay and try and control the shopping trolley, otherwise God knows what's going to happen. And I think part of the problem was people thought that, like in 2019, a lot of people thought, like in 2019, I had a lot of influence over the Prime Minister, and a lot of things he would do what I said. And whilst that had been the case in 2019, from 10 o'clock on election night, as soon as he had an 80-seat majority, that situation changed almost immediately. As I said, I think I definitely should have gone in September, without any shadow of a doubt in my mind now. The reason why I didn't was because it was clear that we were heading for another disaster, and there was going to be another whole set of meetings. And I thought, well, maybe I'll be able to force this through.
Irrespective of what other people thought about your influence, clearly at this stage you must have reasonably assumed that you didn't have the type of influence that you thought you did. In fact, you said as much after 10 o'clock on December the 12th. So surely the logical thing then would have been to take an alternative course of action.
Well, as I said, I think I think I'm half agreeing with you. I think I definitely should have gone in September.
And what do you think the outcome would have been if you had?
I don't know, but as I said, 20 minutes ago, I think it was one of those gambles that was worth doing, because my relations with him were already broken. At the latest, I was going to stay there until Friday the 18th of December, so we were only talking about 12 weeks anyway. If I'd gambled then and said, I will basically call a press conference and blow this thing sky high, and then he'd caved in and done it, then tens of thousands of people would now still be alive, and we could have avoided the whole horror of the delays and the variants and Christmas and the nightmare that the country's gone through in the first quarter of this year. So as I've tried to say, I think I made the wrong decision, and I apologise for that.
Thank you very much indeed, Chris. And the final member is Sarah Owen.
Thank you, Chair. Thank you, Mr Cummings, for your time today, and I really appreciate it, because we've had far longer with you than we've ever had to be able to scrutinise the Secretary of State or the Prime Minister, and I think that is a real problem. Moving on to that, I've just got a few quick questions. You've accused Matt Hancock of lying repeatedly. Will you publish the evidence publicly today?
I'll definitely have a look at evidence that I've got. I think in general, it will be better. It's better not to get into the business of publishing people's private messages and WhatsApps, and I don't want to embarrass and make. Some of these people are in position now, and publishing WhatsApps with the Cabinet Secretary and people like that is a very big step. What I think should happen, I think far better than me randomly start, throwing WhatsApps out on the internet, is that you, the MPs, should force the government. MPs have the power to force the government to face this reality and to discuss the things which I've discussed today. You have the power to do that, and what should happen is that the MPs force this situation.
We have that power.
Sorry. I do think it's important that if a serious an accusation as lying is made, that should be corroborated after this hearing. There are other things that can hang in the air, but I think that is a specific requirement.
Perhaps it could just be evidence given to the committee and not published on the internet.
Well, I'm sure the committee will find a way to receive.
I'm happy to discuss that process. Also, obviously, I have to take some legal advice on the whole thing as well, and about the public inquiry and whatnot. But I think that people like the former Cabinet Secretary and others should be here in the seat like me, under oath, explaining what happened, and like me saying what we think we got right and what we think we got wrong.
Thank you, Mr Cummings. I'm going to move on to procurement, because you mentioned it several times as being chaotic and not fit for purpose, and was something that you wanted to change before the pandemic. Now that falls under the Cabinet Office. Do you think Michael Gove is culpable in any of the chaos that you had described around PPE procurement, or any of the contracts that have been dished out around COVID and our response to COVID?
I don't think really that. I don't think that really Gove had a huge amount of responsibility in a sense for this. There are officials in the Cabinet Office, yes, who were in charge of certain aspects of this, but procurement is not just done centrally from the Cabinet Office. Every department is running its own procurement operation. So what happened during the COVID crisis is that some parts of procurement exercise inside DH were pulled out of DH and given to the Cabinet Office to run. That is correct. But it's not as if, it's not like Gove is in charge of government procurement.
He's the minister responsible for the department in government which is responsible for procurement. Are you saying that he shares no burden of blame in this situation at all?
I mean, I'm sure that he would say, like all of us involved, like all senior, I don't think there's a single senior person involved with this who would say that they didn't make some serious mistakes in this, and I'm sure Michael would say the same, that he made mistakes on it. But at the heart of, we went into the crisis with the wrong system, and everybody had to kind of try and bodge your way through that.
Okay, thank you. I'm going to move on to the issue of lockdowns. Who in the Cabinet was a block or a delay on the second lockdown, or was sceptical about lockdowns in general?
I don't remember the Cabinet being involved in the discussion.
There was no discussion about the second lockdown with the Cabinet. It was entirely the Prime Minister.
Not in a meaningful way. As I said, I mean, I never attended Cabinet in 2020. Okay. I tried to keep out of political stuff. I didn't attend Cabinet. I mean, the way that Cabinet works now, it's largely a Potemkin exercise. So I saved my time and didn't want to go. I didn't also attend PMQ's meetings all year either. First time I saw PMQ's was a couple of weeks ago, since the election. So there may have been a kind of one of the Potemkin Cabinet meetings about the lockdown, but I was in the meetings where it was actually decided, and it was just the Prime Minister, and it was the Prime Minister, Cabinet Secretary, Valence, Whitty, me, and other officials there arguing this stuff out, and it was the Prime Minister's decision. So there may have been a Cabinet meeting, but that was just for show, not as a relevant part of the decision-making process. Unless I've completely forgotten some Cabinet that was significant.
Thank you. You've told the committee that the Chancellor Rishi Sunak was totally supportive of lockdown in 2020. That's a pretty interesting statement and endorsement from you, given that you've been pretty scathing of other ministers. Did the Chancellor provide scientific evidence or medical advice to back up the safety of his scheme, which literally had his name on it, Eat Out to Help Out?
As I said before, I wasn't really involved with the Eat Out to Help Out thing, so I don't really have very much useful to say about it. I'm just for complete clarity on what I'm saying about the Chancellor and lockdown. There have been stories saying that he was a kind of block and tried to throw mud in the gears, and him and the Treasury were trying to stop the first lockdown. What I was saying was there were powerful voices in the Treasury who were saying the real danger here is economic and we shouldn't do this. But in the meetings that I had, the Chancellor never tried to stop that happening. And in fact, when I went through with him Plan B and said, here's what I think we should do, we've been given this thing where it's either wave 1 or it's wave 2, let's shift to Plan B and try and build all of this stuff and escape. The Chancellor was completely supportive. And in fact, what I ought to have said earlier on and forgot, one of the key architects of that Plan B was actually the Chancellor's Chief Economic Advisor, Mike Webb. He worked with Ben Warner and Mark Warner on, trying to figure out what the hell this Plan B looked like. So those stories are false. It's in the autumn, the Chancellor was extremely sceptical of what Hancock and Department of Health were saying, but his scepticism, he could appreciate my argument about where I was coming from. His argument was, A, there is no plan from the Department for Health on what we do next. Secondly, we cannot be in a situation where we just constantly trolley from one side to another. Eat out to help out, get everybody back to work, lockdown again, circuit breaker, stay at home. Then 3 weeks' time, the Prime Minister got... Because when we were having this discussion, the Prime Minister was like, well, we can do this for 2 weeks and then, we'll tell everyone to come back. And the Chancellor was saying quite rightly, the economy doesn't work like that. If you're going to say to people now, we're going to have to do another lockdown, you have to realise that a lot of people are going to conclude the government's lost control of the situation. They told everybody to work from home. before, then they told everyone not to work from home, now they're telling everyone there's going to be another lockdown. A lot of businesses are basically going to say that's it until the spring, and they're going to shut the doors. And you need to understand that. And Hancock and Department for Health don't have any plan for that. And we can't just keep careering around backwards and forwards like this, otherwise we're going to have complete bedlam. And that was the core. What the Chancellor was begging for was finally a consistent plan that we could stick to for more than 2 days without being knocked off course by the Telegraph.
Thank you. So the reports from September 2020 that the Prime Minister did not impose a new lockdown over fears that Rishi Sunak would quit are untrue, are they?
Completely, 100% correct. I know I was there. The Chancellor never threatened to quit, and he didn't tell me at the time. I had private meetings with him about the situation and about all the difficulties of it. He said to me, for God's sake, please don't you quit. I mean, I know you want to, but don't. That story is definitely false, and he was definitely not throwing around resignation threats. He was just desperate for a plan that was coherent and the government could stick to. And like lots of us, was just completely at his wit's end about the shopping trolley.
I think some people might ask whether you're hedging your bets slightly with an eye on a future administration run by Rishi Sunak. Is that out of...
I think everyone, from my wife to everybody in Westminster and Whitehall, will agree that the less everyone hears of me in the future, the better.
Thank you. So, why do you think the government are blocking a COVID inquiry now? And do you think that the 128,000 people that have lost their lives and their loved ones deserves answers now?
Yes, as I've said all day today, I think they do deserve answers now. I think it's genuinely terrible, the idea of trying to punt this all off till after the next election. When you have a crisis this bad, you've got to face reality. And the fact that the government, I mean, it's beyond absurd. We're in a situation where millions of people watched the government have an official policy last March, and now Number 10 is just trying to claim that it didn't exist. Now, my point is, if they've lost the plot that badly in there, what on earth else is going on in that building?
Thank you. This one's quite specific. You tweeted and have spoken today about the unwillingness to learn from East and Southeast Asian countries because people were saying, and I quote, "Asians all do what they're told, so it won't work here." Who said that? And how much do you think that this outdated racist stereotyping has contributed to the numbers of deaths in the UK?
I don't want to kind of get into quoting things like that, because I think it would be unfair, and I think it would be unfair on some of the scientists and others involved in it. I think it's undoubtedly the case that there was a general view. I wrote about this, I think, in 2014 or something, about the Department for Education. There is a general problem in Whitehall of parochialism, that people don't want to look at what's happening abroad. And there is a specific issue about thinking that we can't really learn from East Asia. And that has been around for many, many years. It undoubtedly I think actually a lot of senior people would openly admit to you. We all know what the conversations were in January and February. I mean, I've got WhatsApps between me and all kinds of senior people. The view was that the public won't accept lockdown, and the public won't accept the kind of surveillance, the whole kind of test and trace infrastructure. And my argument and others' argument was, actually, if you look at somewhere like Taiwan, you've got a very small but serious curtailment of civil liberties in some ways. If you want to go in and out of the country, you are quarantined. They don't have a joke system like we've got. You are in a hotel, it's patrolled, you're not leaving, forget it. It's ultra serious. But then if you walk around Taiwan, it's basically life is, I've got friends who live there, life's basically normal. If you're faced with the choices of massive wave killing hundreds of thousands, or that, I think almost everybody in this country would say, let's go down that route. And that's the route that we should have started to go down in January. We started to think about that in mid-March, but it took a few months really for that new thinking to kind of develop into real policy and develop into real operational capabilities in certain ways. But you don't change big cultural barriers like that about learning from abroad quickly, and I think it'll take time for Whitehall to adapt.
Thank you, and this is my last question. You've described the PM's running of Number 10 as chaotic, incompetent, lacking judgment at times. Do you think Boris Johnson is a fit and proper person to get us through this pandemic?
No.
Thank you.
Thank you very much indeed. Just reflecting on the autumn and the winter, we're approaching this with hindsight, clearly, as we do everything. What we do know that happened was that there was a Kent variant that has contributed most of the deaths since the summer, but we didn't know about it in September. And in evidence to the Science Select Committee, the chair of NervTag, Professor Peter Horby, on the 23rd of December, was asked if the government had acted in a timely way. And he said, I think they have. We sent our first note to them, raising a significant concern on the 18th of December, and on the 19th, measures were put in place. So this is at odds with the kind of repeated cycle of delay in inaction that you're describing, is it not?
I don't think that's right, no, because although the specifics about Kent may only have come up at that time, it was certainly the case that variants were being discussed in September. I had scientists say to me in September that one of the reasons why we've got to not let this get out of control is the problem with variants. So it was, if I knew about it in September, that means that other people definitely were talking about it well before then.
But not a specific variant, it was a concern about variants in general.
I can't remember the detail of my conversations now on variants, but it's certainly the case. I had specific warnings from scientists, and not just any old scientists who've been repeatedly proved right. So I took what they said particularly carefully. Now, I was looking back over the whole thing and doing a kind of scorecard of who's been right about this and who's been wrong about it. And the people who were right about it said to me in September, watch out for this variants thing, it could suddenly get very nasty, you could have a really, really serious problem with it. And the same people who were right about that in September, the reason why I brought the issue up recently publicly was because the same people were saying the same thing to me in January, saying the government is not acting properly. We still don't have a proper border policy.
The committee has taken extensive evidence on variants, and you will know that variants arise all the time in their thousands. That's the nature of viruses. And so, given that we were in September, we now have the benefit of the hindsight that tells us that we know about there was a particularly dangerous variant, infectious variant, the Kent variant. We also know that we have vaccines that in September and October were not approved for use. So would it have been reasonable, based on a generalised concern about variants, not a specific concern that one had been discovered that was very infectious, isn't to impose lockdown restrictions without any particular intelligence as to a variant that required it? Would that not have been a recipe for permanent lockdown?
But with respect, that's not at all the situation that we actually faced. In September, the argument was not at all about variants. It was about the existing case. And the point was that we were going to have to lock down in 5 weeks because of the existing variant. It wasn't about variant. The argument in September wasn't lock down now preemptively because of variants. The argument in September was the data on current hospitalizations, current cases, ICUs, blah, 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 is all completely clear. You are going to have to lock down at the end of October to stop the NHS being washed away again. And the whole lesson of this situation is, once you get to a position like that, there's only two logical positions. Logical position A is deep breath, forget it, we're going to let the wave crash and it's going to be what it's going to be. Option B is we're not going to do that, that's inconceivable, the risks of it are too high, therefore we're going to have to lock down. As soon as you make the decision that we're going to have to lock down, you do it today. Because that's what exponential curves are. The faster you act, then the faster you get on top of it, and then the faster it exponentially decays. And that means you don't have to have it in place for as long, it doesn't have to be so deep, and everything else. That was what the number 10 data team was saying to the Prime Minister in September, and what the chief scientist and the chief medical officer were saying. It wasn't anything to do with variants, and that is exactly what happened. When we all came back on Friday the 31st, and we looked at the data, it was basically what Catherine Cutts had read out 5 weeks earlier. That's why the Prime Minister was so enraged by the situation, because he knew that me and others were looking at him saying, you know, you were told. Catherine Cutts read out all of this information to you, and that's what we're now looking at. And now you're doing it again, and now the lockdown's going to have to be worse, the destruction is going to be worse, and that means thousands of people have caught it in the intervening 5 weeks who are now going to die, and we're doing the lockdown anyway, and we're going to trash the economy more anyway.
So in that circumstance, before we had vaccines that had been approved, quite a long time before they were approved, with that rise in infections, what your advice would be to engage in a series of lockdowns to keep infections at a low enough level for an indeterminate future. Would that be right?
So I left before the kind of big conversations with variants happened. As I said, I had some conversations about variants in September at the latest, possibly even August, I can't remember now. I mean, my view was, in September, if you whack it now hard, then we get on top of it. And also remember at that time, we were in the process, I was spending a very large part of each day and each weekend working on the mass testing thing. So we were having these things kind of balanced out, and I was saying to the PM, look, okay, we've totally screwed it up, and we should have been doing this mass testing since March, but we didn't realise until July. Okay, we're now pushing everything we possibly can behind
Hello
it.
there, everyone.
The Cabinet Secretary is doing a brilliant job. He's pushing all the officials behind it. If we smash it now in September, then we've got a chance to, then when we come out in a month's time, to come out with millions of these tests starting to be available. And then the game can be different. And the tests can also help in terms of dealing with the variants. That was the fundamental argument.
So yeah, I just wanted to break in here very quickly. Oh, the mic's all the way down there. That's better. Yeah, you are watching the third part of Dominic Cummings answering questions for the Science and Technology Committee and the Health and Social Care Committee. This has been a belter of a session. If you ever wanted to hear Matt Hancock get slated for a whole day, then this is the show for you, basically. I'm not going to say too much more. I don't know how much longer this has got to go. We're going to stick with it until it's over. So, sorry to interrupt there. Enjoy the show.
James Phillips and others, Patrick Vallance, were saying this argument in September.
I think we should conclude, but this is a lessons learned inquiry, as we said some hours ago at the beginning, and we've taken a lot of evidence from a lot of different people. This is the penultimate session before we write our report. Just reflecting back on your time in Downing Street dealing with the pandemic, what are the key lessons that you would learn that, as in the way of lessons, can be applied?
I think there's a general principle of making things like SAGE and scientific advice more open. I think there's an obvious question about responsibility, like a really fundamental question about how the British state works, about power between ministers and officials, and who is actually in charge of things and who can actually form teams. In normal government business, the assumption is, well, we can just all we can all live with a bit of friction to have this kind of division of responsibilities and muddle along. But it's completely fatal when you're dealing with a really serious thing. Because when you're dealing with a really serious thing like this, you need to get a great team that knows exactly what the goal is and exactly who's responsible for what. And the Whitehall culture of how responsibility is deliberately diffused is intrinsically hostile to high performance management. Intrinsically hostile. If you put Bill Gates himself, any great people from history who really understand how to run these kind of teams, all of them would say the first time you put them in the job, they're like, how the hell am I supposed to manage that? If I can't pick who the team is, and I can't fire them, and I can't bring people in. That connects to the general, what if there's one change that you could make in terms of the civil service, there should be, the HR system should change so that all appointments with a tiny fraction of national security oddities, which are not really relevant, fundamentally 99+% of civil service jobs should be open by default. The competition for them should be open by default. We've got so many brilliant people in this country. And then we have a civil service system which literally puts a massive barrier and says, we're going to recruit all of these things from internally, like a caste system. It's completely crackers' way of doing things. Again, during this thing, we had to go out and get external people to come in and provide all kinds of crucial skills. But that shouldn't be just something that you do because there's a crisis. The British system should be open so that we can get the best people in the country to the best jobs. Now, I know from conversations that there are lots of senior people who agree with me, but parts of Whitehall will fight to the death to stop a culture of open by default jobs. But I think if you're going to make one change in the system, that's one of the most crucial. And the other thing is really thinking hard about incentives, because people are not incentivized to tell the truth. They're not incentivized to think through hard problems. They're not incentivized for operational delivery. People are incentivized to keep their heads down, to back up the system when it fails.
I just wanted to let you all know there's about 5 minutes left on this session, so you've got 5 minutes to go. Of course, if you want to see the coverage of this, people talking about it, you can go to Sky News, because this is already finished. You can hear the pundits talking about it. That's what I'm going to do now.
Taken seriously.
I mean, why not?
Have stupid words like strategy in their job titles, but the people who actually get things done are not respected often inside the system. So that's a huge point, and that connects finally to, I would say, the culture, the meeting culture of how we do things. Over and over again in this crisis, we would just about get to the point where the crucial thing would be exposed, and some senior person in terror would say, let's take this offline. And I would sometimes shout, no, let's not take it offline. Let's keep it online. We're just almost about to get to the bloody point. But you've got this culture constantly in which things are elided away, let's not bring up, let's not embarrass anybody, let's not really get to the heart of the problem. And again, that's normal in Whitehall, but when you're dealing with a problem like this, it's a complete and utter disaster.
And you fell into that trap yourself, you said this morning.
Yeah, well, we were all in these ludicrous meetings with people saying, take it offline, take it offline, take it offline.
Okay. Jeremy.
Thank you. Well, first of all, thank you very much for giving evidence today for over 7 hours. That is really appreciated. I just want to ask you finally about one of your last comments, which is that the Prime Minister is not fit and proper to do his job. And I just want to ask you about your own record, about which you've been admirably honest today. When you think that you were someone who attended SAGE, who was known to take a great interest in science, but it wasn't until March the 11th that you advised the Prime Minister that we needed to change direction. It then took more than 2 months after that before we had a test and trace system set up. You then didn't win the argument for the circuit breaker in September. We didn't have weekly testing of NHS staff.
Proceeding will start shortly.
To people, I did try and get outside.
Well, I'm not actually sure what happened there, so I'm just going to turn it off there for just now. Well, I actually know exactly what happened. Basically, they were just summing up. There's nothing else happens after this point. They're just waffling, saying thank you, and they're glad handing him on their way out. That was just the last, the goodbye section that just cut there. Yeah, the stream that we had on, the stream we were watching was 5 minutes ahead of reality, and it all just caught up and crashed into each other in epic fashion, but it's okay because I was here. So let's get Big Dom's face off the screen for now. So that was today. I don't know what you thought of that. I don't know what to make of that. We've just sat, the stream's been live since about 9:30 this morning, so it's 7 hours. more than 7 hours, including breaks, of course. Dominic Cummings has answered a heck of a lot of questions today. Like, fair play to him, because none of the politicians have answered any questions as fully and frankly as he appears to have done today. So it's been really interesting. My personal thoughts on this before we go, I don't think Dominic Cummings really has any reason to lie. Sorry, I just realised how loud that microphone was. Sort that out. Yeah, I don't think Dominic Cummings really got many reasons to lie. I think there was times where he clearly tried to hide things. Like, for instance, when the times he boasted about having WhatsApp conversations with people and having the evidence stored on his phone, but then as soon as they're like, "Oh well, can we see that, please?" He's like, "Oh," so you could tell. I don't think he tried to hide things. I don't think he lied about anything, but he most likely tried to hide things. You can definitely see there's two teams here. You've got Michael Gove's team and you've got Boris Johnson's team. Michael Gove's cabinet secretary. So obviously you've got Gove, Sunak, Dominic Raab on one side, which seems to be the team that Dominic Cummings was more like affiliated, more connected with, which is, everyone obviously thinks it's the other way, but yeah. And then on the other side you've got Boris and his team of idiots. This is not a good way to run a country. You know what I mean? Whatever side you want to take today, whoever you want to think is on the right side of history with this, this is just not like that was he said multiple times that Matt Hancock's lying, and he gave the evidence, gave the proof, and I mean he's on record. He can't lie. You can't lie in those situations. I'm pretty sure you've got to take an oath before you speak at these select committees. It's serious business, you know. So I don't think he's got any reason to lie. So, and if we go on that, it's really, really pretty staggering. I mean, there's a common like thread that goes through political discourse that somehow Boris Johnson and Michael Gove are buddies. I don't think that's the case. I think you can prove that. Gove's tried to stab Boris in the back before. I think Tories just like keeping their enemies closer. Anyway, I'm just waffling here. I'm probably going to try and find the transcript to read this, and I'll maybe do a video tomorrow on this, talking about it more in depth. We can sit and chat about what happened or whatever, but for now I'm going to wind the stream up. Go have yourself a coffee. If you've been here all day, thanks very much. If you've not been here all day, or just in general, subscribe to the channel, check notifications on so you know when it is live. Follow me on Twitter at BrokeBritannia, or on my personal account at SteveSmithVB, or sorry, Smith. I don't even know what it is, just ignore that last bit. I'll see you all later. Take it easy, everyone.